Bible says too. Is this?
That's correct. Or for City Hall, correct. If it's 5, okay. Are we on? No. Okay. I'd like to call to order the Avalon City Council meeting of Tuesday, April 7th. If we would please stand for the Pledge of Allegiance. And begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And if we could please take a few moments to remember Pete Wilson, who was a very vibrant part of City Hall for quite a number of years, and once again for Billy Engel, and also for Trish Brown, who is a teacher here at Avalon. And I would also like to take a moment for those who are ill and who have contracted the COVID virus. We wish their families and themselves a quick recovery. I'd also like to pray for all the employees throughout California and the United States who are processing literally millions of unemployment checks, those sustenance checks, SBA loans, and paycheck protection applications. They have an overwhelming job, and we wish them well. And of course, for all of our first responders who are out there risking their lives to protect our communities. Thank you. Roll call, please.
Go ahead, Michael. We have a new Gabby this evening.
Mayor Marshall.
Here.
Mayor Pro Tem Cassidy.
Here.
Councilmember Olson.
Here.
Councilmember Haves.
Here.
Okay.
Just to remind the public that's watching, since we're not allowing the public to come into the chambers quite yet, that you can view the City Council meeting on the cityofavalon.com/meetings or on our Facebook page, which is facebook.com/City of Avalon official. Michael, and I forgot the wording for the e-comments. Where would they log in to make comments during the council meeting for oral communication and for agenda items?
I believe that is avalon.granicusideas.com, or you can log into avalon.granicus.com.
Here's the expert.
If you just go to cityofavalon.com/meetings where you watch the meeting, it has e-comment right there where you can watch the meeting live or view the agenda. And you click on that and it'll take you to those links to provide your comment.
One more time, nice and slow, Jordan.
cityofavalon.com/meetings. Or if you just go to our main page on the right-hand side, you'll see view City Council meetings or view Planning Commission meetings. Click on either of those. It'll take you to the right page.
Thank you.
Thanks, Jordan.
Announcements and communications.
I do have an announcement that we are making further cuts with City Hall, and as far as employees and hours of operation, City Hall is Monday through Thursday, and the public can access all the departments between the hours of 8 and 12, Monday through Thursday. There will be somebody at the front counter that will be manning the phone, as well as if you need commuter subsidy, and we're trying to limit those days and the interaction with the public to only Monday and Thursday.
So after 12 o'clock, there's no communication with the public?
You can go through the phone system to get the extension.
Okay.
And then I'll just go on with all my other announcements, Mayor?
Sure, please.
So we had received some communication from the Island Company, and just as a heads up to locals, that the public restrooms down at Two Harbors are closed. The Catalina Express is really encouraging, and I know the mayor has other statements to make, but the Catalina Express is really strongly encouraging the public to make reservations. That way they know how to, which boat to run and how to accommodate for the social distancing. It's extremely important at this time. And I know Islanders, we are infamous for just showing up at the counter saying, I don't have a reservation. So at this time, it's extremely important. The harbor fees, which should have changed on Palm Sunday, it will remain pay for 2 and get 5 free, and that is until further notice. Property taxes are due on April 10th, and the county has said if you haven't filed by that date to go to their website. And I'm just going to read this one little sentence. It says, beginning on April 11th, the day after property taxes are due, people unable to pay on time for reasons related to COVID-19 may submit a request for penalty cancellations. And you can only do that online. We have put our taxi ticket program, is no longer available. It's been suspended because that money comes all from our general fund. However, if you have taxi tickets in your book, you're still able to use those, and you would be using our Dial-A-Ride program. Originally, the Dial-A-Ride is only for if you're over 55 and disabled. That will not apply. And so when you call, the only information you would need to provide them is your name, the pickup address, the drop-off address, and giving your date of birth. And that's all that you would need.
And that phone number is 310-510-0081.
That's it. Thank you, Annie.
Yeah.
And they have a whole process for cleaning the vans after each person gets out of the van. And let me see what else I have, Annie.
And what might we recommend that they wear a mask when they get into the van?
Yes, the drivers definitely are wearing a mask and gloves, and I'm going to let you talk about what you're asking of the public for mask, Annie.
Okay. And that's all?
Yes, because I think my department heads will be saying the others.
Okay, department heads.
Good evening. Bob Greenlaw, Director of Public Works. One quick item here. We have a much reduced workforce in Public Works, harbor, maintenance, garage. So what that means to us, some of the tasks that we would normally do, they're going to be either less frequently done, or they're going to be eliminated, for right now in their entirety. So things like our landscape maintenance, our daily sweeping, you'll see those things happen less. So, but really our focus right now is maintaining our critical infrastructure and making sure that everything works for the town while we're under this set of circumstances.
The bathrooms on the Sconso, on Casino Way, are we going to, is that roof finished?
No, we need to get some flashing, and it is a priority project as we fit it in with the rain.
Okay. So
And you'll see that continue on. There are a few projects that we have open right now that will continue on. You'll see our crews masking up, spreading out, operating singularly. Right now, one of our main pushes is we've got a lot of vegetation to knock down, so that we don't get ourselves in a problem when it comes to fire season. So you'll see a lot of individual people going out and trying to work on that vegetation for 3 to 4 weeks. Okay?
Questions? Good. Okay, thank you.
Mayor, I forgot to comment for the record that Scott Campbell is in attendance via teleconference. That's for the record.
Hello, everyone.
Hello.
Good evening, Captain John Hawking, Sheriff's Department. And I would just like to thank the community. There's so many people that are complying with the Safer at Home order. The majority of the Avalon residents are doing an outstanding job. We're still getting calls on juveniles, and we're getting calls that are driving around in golf carts, just cruising around. So if you're a parent and you have juveniles, please keep them in the house unless they're going someplace that they're allowed to go to, such as Vaughn's or school to get a meal, whatever it might happen to be. But we're really asking for more people to comply, but I don't want to overlook all the people that are complying, because a majority of the people are complying in our community. And that's all I have. Does anybody have any questions for me?
No, great, John, thank you.
When you guys are doing your sweeps through town, can you also make a trip over the hill for near the gate?
Hogsback Gate? Yes, we will. We'll do both sides. Yes, ma'am. Thank you.
Good evening, Mayor, Council, City staff. I just wanted to quickly bring you up to speed on this year's brush clearance and weed abatement. Typically, April 1st, we kick that off with a June 1st deadline. We've amended that a little bit this year, just not for the clearance requirement, but in the way that's going to get done. With the current COVID-19 pandemic and specifically the current stay-at-home shelter-in-place order, there could be situations where brush clearance, weed abatement can be started by individuals on certain properties while maintaining COVID-19 safe work practices. However, there could be properties where those same COVID-19 safe work practices could not be implemented due to the size of the area being abated and the crew required to accomplish that task. Additionally, many employees have been furloughed recently, limiting the amount of staff normally available to accomplish this requirement. The recommendation of the City of Avalon Fire Department, while under the mandated stay-at-home shelter-in-place order, is to begin weed abatement and brush clearance requirements as soon as practical if COVID-19 safe work practices can be maintained. The brush clearance, weed abatement requirements are critical components of the wildfire mitigation efforts each year for both the City of Avalon and Catalina Island. The goal this year is to complete those efforts as completely as possible while maintaining the following pandemic safety measures. And then there's a list of those measures below it. It's all the same stuff that we're currently doing about practicing social distancing, limit the amount of people that congregate. If you're sharing tools, be sure and disinfect those, and practice proper hygiene. All this is on the website. If people go to the City of Avalon website and click on the red bar at the top with all the pandemic measures, and then they scroll down to the updated city operations, it's there. And the question has also come up, that is landscaping and weed abatement considered essential? It is. So it is essential, and it's not restricted in any way, just provided safe work practices are maintained. And that's all I have, unless you have questions for me.
Questions of the chief? No, thank you very much.
Thank you.
Good evening, Mayor, Council. Speaking for the Building and Planning Department, we want to make sure that everyone knows that we have canceled the Planning Commission meeting for April, and so that meeting will not be taking place. We want to remind everyone that the building official, John Gilbert, is still available 3 days a week, so we do have active construction projects ongoing in town, and so he is still available to do those inspections. We are still issuing permits. You need to reach out to the department via my extension, which is extension 110, 310, 510, 0220, 110, and we will arrange to get your permit issued. This is not an opportunity to do work without permits. We are in the department Monday through Thursday. And then we just want to remind everyone that we have also included on the website the standard construction site guidelines for COVID-19. And as the chief said, it's your standard practices, social distancing, hygiene. Those are available on the department website, on the city website. So if you need copies of those, we can also email copies out to anyone who might need those. And I think that's all I had. Do you have any questions for me?
No, thank you, Amanda.
Matt Baker, Finance Department. To the lessees of the City of Avalon, as outlined in the emergency ordinance that was adopted at the last meeting, just want to let them know to please contact the Finance Department if the state of emergency has created a situation where there's an inability to pay rent. I want to emphasize that the city will not be charging any penalties or interest on any deferred rent as outlined in that ordinance, but I do ask that they reach out to the finance department so we are aware. To the business taxpayers, I want to start by thanking the many businesses that did faithfully remit payment last month. The city does rely on those monies in order to fund its essential operations. And to the businesses that still have not paid, to let them know there will not be any exemption to applicable penalties and interest. It's critical as we manage these difficult times that we have the ability to continue to fund essential services, and we rely on those businesses to make those payments. So unfortunately, we will not be making any exceptions for late penalties. And then lastly, also to encourage social distancing, I just want to point out that all of the monthly reporting forms are available online in a fillable PDF format, so that way there's really no need to interact directly with finance staff. Those forms can be filled out online and emailed along with payments. I will be presenting later this evening, but if there are any questions.
No, thank you very much, Mayor.
Good evening, Madam Mayor, members of the council. With all the gloom that's out there, I wanted to talk a little bit about some of the things that the community is doing to respond to those that are in most need in our community. The Lord's Cupboard Food Pantry at Avalon Community Church has seen a great outpouring of support over the last few weeks. If I can take a couple minutes, I just want to highlight some of the people that have reached out so far. We, in void of having a March Madness this year, we've got our true champions. We've got our Elite 8 and our Sweet 16. So our Elite 8 kicked off with Gary Johnson, who I reported out, really got the ball rolling, the Johnson family, with a real nice donation to the food pantry, followed by the Rusak family, Susan Marion, the Blue Water Group, Lions Club, the Catalina Island Foundation have stepped in, and they've stepped in a big way. They've got a $10,000 check that's on their way with additional support down the road. The Catalina Yacht Club, and then Blaney Haganah would be our Elite 8. Our Sweet 16 was the Haves family, kicked off with a nice donation of sanitizers, and then opened up one of the restaurants for refrigeration purposes as we get further into this. Janny Eisenhut, Laura Vander Zandy, Paula Patterson, the Diaz family, Elizabeth Hewitt, Patrick Braille, our finance director, Mr. Baker, Bernadine Curtin, Chuck Wright, Janelle Hewitt, Janny Hall, Gail Hodge, and then as of this afternoon, James Busby. So really appreciative of all their support. We have probably collected upwards to $26,000 with some commitments from other groups as we go further into this. Ways that you can support, there's three ways. We've got donation boxes, food donation boxes at 3 locations, just out of Bonds. There's 2 boxes there. There is one at the Teen Center, just at the doors of the Teen Center, and then there's one just outside of Leo's off of Sumner. You can also go to the AvalonCommunityChurch.org website, make a direct donation through their online services there, as well as go to the City of Avalon website, the COVID-19. We have a mutual aid button that you can donate there. 2 last things. Just want to remind the community, and it's been out a little bit, but they are still, the school is still offering the school lunch program. It's open Monday through Friday at lunchtime. You can grab a lunch, and they'll send you away with a breakfast kind of to go for the next morning. So that program continues to go, and that's from 11:30 to 12:30 at the school site. And then the Avalon Mutual Aid Program, the hotline for those in the community that need assistance, the phone number is 310-780-0938. We took a request from our harbor master yesterday, and we were able to service it. There was a couple families, there's a few families out at White's that don't have the ability to, we're trying to keep them out of the harbor, don't have the ability to come in. We did some shopping for them, met them at the float, and we were able to assist in doing some shopping for them. One of them was, I think, heading off today for Hawaii. It's going to be on the water for 30 days and needed some essentials, so we were able to assist with that. So, Thank you. Food pantry's open. It's 12 to 2 on Wednesdays. We're going to start tomorrow, opening up at 11. We saw 75 families the first week. We saw 115 last week. We're expecting, probably close to that, if not more. So looking to kind of spread that time out a little bit for social distancing and a little more of an opportunity for the larger numbers that we're seeing.
That is wonderful. This is our Avalon family, and this is what they do.
It's absolutely wonderful
fantastic.
to see people come together. Yeah, great. Thank you.
City manager, anything else to report? Okay. City attorney, do you have anything up there, Scott?
Yes, we have sent 2 letters to federal legislators asking that aid to local cities be included in the next aid package. And today we hosted a webinar where we had over 1,000 attendees, and that webinar was on how to apply for and hopefully receive money from the federal government as a result of the COVID-19 crisis. So even though we're not at the meeting, we're still here with you in work and in spirit.
Thank you very much. Council member reports.
I would just like to say to my fellow council members and mayor, it has been a pleasure working with you. We've gotten along extremely well and have the utmost respect and professionalism for each other, which really sets the tone for a council to get things done. So thank you. And to Denise Ratty, our city manager, Michael Almer, our assistant city manager, and all the department heads and other city workers, you guys do a great job. I know sometimes people pick a few things and don't think that certain things are going well, but I know what you do, I know who you are, and you are extremely professional, and it's been a pleasure again working with all of you in that capacity, so keep up the good work. To the 437 people that voted for me, I know who you all are. I just want to say that I appreciate you, that you trusted in me, that you felt like I was ready to do the job, and there's a lot of great things we were going to do, and I just want to thank you for that. And to the new council, congratulations, and look forward to seeing what you guys do.
Why did you always go first?
How about a ditto or something like that?
See, I've got a couple more years now, so I believe it's the last 8 years I've spent here has been very productive. We've done a lot in the community. I think Joe Machado, when we got here, that field was closed for 4 months a year, and now it's used every day. It could be used every day except on rainy days. Our staff is 100% perfect. They do a really great job. Working with the council has been fun. It's been productive. It's had a couple disagreements, nothing serious. To the new council, good luck. Big seats to fill, and thank you very much. And I don't remember how many people voted for me, but I know who they are too. I know who didn't vote for me.
Cindy?
Getting all sappy up here. To Mayor Annie, congratulations. To the new council, congratulations. To both of you guys, agreed. It's been an honor, an absolute honor and a privilege to work with you. The last 9 months or so have been very comfortable, and I feel that I've learned so much from both of you, from all of your years of experience, and I appreciate it very much. I look forward to still working with you in our community. And I also want to say to our city staff, wow, Denise, Michael, you guys have been unbelievable through this crisis. You've handled me very well, and there's a lot of tension in the community. There's a lot of unsurety, a lot of stress. We all feel it, and for the city staff who's backing you as well, I just want to say from the bottom of my heart, thank you so much. I really do believe that we are in good hands with you guys at the helm. And I hope that, we continue on and eventually we'll persevere through this. But thank you for all of your efforts.
I have a tremendous staff.
Yes.
Support system, all the employees.
Yes. Oh, and I'm sorry, one more thing, and you may be touching on this as well, but just a reminder that I've seen some really wonderful things written out there in the community, and I just want to remind everybody that each person is handling this crisis in their own way, and we really need to stop judging for the way in which we see other people handling this. We all have our own methods, we all have our own triggers, but really this is the time that we've seen from a majority of our community. This is where we need to stand up and stick together. And while we are seeing that, I just want to say again for everybody to please be kind to one another.
Lovely, thank you. What do I have? Well, we can start with, since Tony Zeiler isn't here, those of you who have an opportunity for safe distancing, along with the weed abatement people, if you can just sweep the front of your home, take a little pride in it, because I know you have the time. That's one little thing. 4 o'clock tomorrow will be minutes with the mayor, so hopefully everybody will tune in, and things that I'm not going to mention today will also be mentioned there. Masks. So I believe you touched on it, Denise, so maybe I wasn't listening to everything, but you did say that the express boat was going to be requiring everybody to wear masks?
No, Greg Bombard had sent you something to read, Annie.
Oh, I'll have it for tomorrow. I didn't get it for today.
Oh, I can run and get it if you want.
Oh, do you want to? Okay. Yes, okay. And we'll read it again tomorrow as well. And I just have a question on Michael Palmer. So we will be writing a letter on behalf of the hospital. We got all that, the verbiage from Tina today, and we were going to be doing that?
We were talking on the call about doing a potential collaborative letter amongst many stakeholders. Those conversations are still ongoing, but yeah, there will be something forthcoming from the city.
Okay, because, and that is, Jason, is that stuff on your website? So if a constituent wants to write a letter to the legislator, because the information we got from Tina was quite extensive and it doesn't really sound like a me or somebody else. Is there just maybe some samples of a little something a couple lines they could send, or? Okay, so if anybody wants to, of course, be in supportive of the hospital, email them and they will give you the information on what could be stated in the letter to help them. Okay? There's a nice announcement. There's some good news in the world. We all got information from Adeline Union about Southern California Edison. Each year, Edison International awards a total of $1.2 million in scholarships to invest in the bright future of scholars and their communities. And Adeline Union was pleased to announce that Catalina has an Edison scholar this year. Daniel Silva Rios is one of the 30 high school seniors named as a 2020 Edison Scholar. Daniel plans to be an electrical engineer and will receive a $40,000 college STEM scholarship. So congratulations to Daniel and the Silva family. This is the second scholar that has come from Avalon. The other one was Pete Edwards' daughter, whose name is Michaela. So, and she used that scholarship well as well. So congratulations to Daniel and his family. St. Catherine's Church will be closed for Easter service. So if you go on the Archdiocese of Los Angeles' website, they will be having a mass on the website. The community church will be doing radio shows, radio service and web service on Sunday.
Thursday.
Oh, starting on Thursday?
Sunday, Easter sunrise.
Say it again, louder into the mic.
Community Church will do a Monday, Thursday service. We'll also do a regular Sunday service and also do a Easter sunrise service content. I don't think it's going to be at sunrise though. But it's on.
Okay.
It's on
Good. Yeah.
AvalonCommunityChurch.com.
Yeah. Okay. And again, you said it quite eloquently, Cindy. You know, Ole, that I have enjoyed sitting next to you. I truly have, and I'm going to miss your knowledge and your correcting me when I'm wrong, and it's all good stuff, and you are very bright, and we wish you the best, and hopefully you will keep in touch with us, and if we get a call and I'll say, well, what year did that happen? Perhaps you can give us a hand, and because you have all of that knowledge, which is brilliant, so thank you.
Anytime.
Okay. Yeah, he's going to block me on his phone, what?
And Stevie, I wish you all the luck. It would have been fun if you were sitting here next alongside of me, but oh well. So I wish you luck in all your endeavors. I know you have a busy schedule. Not so much right now, but it will pick up, and hopefully you will continue on some of those projects that you feel are so vital to the community in the future as we start to develop again. So thank you very much. Okay.
And Mayor, we were having some difficulties getting Scott in to speak during public comment.
Oh, okay. She needs to.
Hello, can you hear me now?
Yes.
Okay. I just wanted to say during the city attorney comments that we have submitted 2 letters to Washington, D.C. on behalf of the city in support of the next round of aid that will be targeted to local cities, to smaller cities. So we have sent those letters out. In addition, we hosted a webinar today where we had 1,000 local entities and businesses listen to how to get money from FEMA for the COVID-19 responses and the costs that you're incurring. And I know Avalon participated in that. So we're with you through all this. Thanks much.
Thank you. And Michael, that was a very professional way that you were telling me I just skipped the city attorney. Thank you.
No, I think we were having some audio issues.
Okay.
And if you don't mind, could I just throw out the comments because we were having some technical difficulties. For anybody wanting to submit a comment to the agenda, please go to avalon.granicus, that's GRANICUS, ideas.com, all one word. So avalon.granicus.ideas.com. In the meetings tab, click pass to comment on the 4/7 meeting. I know that there are some people trying to get their comments in. We're doing our best to monitor everything, but if you could please copy that if you asked under the ask@cityofavalon.com and repost under the Granicus. You will need to start an account. We do apologize for that, but we're hoping that once we get people into the system, this will be a much smoother process.
And I have a question. Those morning meetings that we're having with the 20-some people on there, is it appropriate for some of the department heads to go back and if there's something relative to their employee or as an employee or as a resident, they share that? Or are we just saying everybody keep it to yourself?
No, it's not for yourself, but it's mainly for because those are all employers, so that gets passed down to their employees.
So it should be, if there's pertinent information, they should be sharing?
Absolutely.
Okay, great, thank you.
And the message from the Catalina Express is that they are going to be requesting all passengers to wear a face mask while they're in the terminal and on the boats. And when you call in for a reservation, you will be told that also.
You're saying requesting or mandating?
They cannot mandate. They are strongly requesting. They're taking the lead from Metro, also the public transit.
Great, thank you.
And they won't take your tickets. No, just one thing. If you haven't done your census form yet, which was due on April 1st, you can go online to uscensus.gov, I think, and if you didn't get an invitation, you just click the little button and it'll take you to the census form, and it takes like 3 minutes to fill it out.
I may have to social distance with you to do that because I tried and I wasn't going anywhere. But anyway, then they gave me a number and then I got them again, they gave me a different number.
Well, you don't get any numbers at all. You just press the button and just fill out the form.
Okay, I'll try it again. Thank you. Okay, are we moving on to presentation?
Yes, we are. And we have Dr. Daniel Davis in the audience again this evening. We're very happy to have him back to give us an update.
All right. Well, thank you very much for having me back. I really appreciate the City Council, the Mayor, giving us this opportunity, as well as the response from the Avalon community, which has been somewhat overwhelming, and we seem to have developed the following even beyond Catalina, which is good. And so this is an update for this particular week. I have data even as recent as about an hour ago to share with you. And you can see from my opening that I'm trying to remind everyone that while we may not have been as affected medically here as in other places, that this is still a very serious thing, and this represents one of the portable morgues from New York City with someone being wheeled in. My objective for tonight is to give you general update on the status of COVID-19 as well as the Catalina update, and talk a little bit about the future as we pivot into a more maintenance phase over the next month or so. And then depending on time, if there are questions, I have some that were submitted by email and by website that we can and we will post answers to online. But if we have time, we can also take live questions. Okay, so the first question I'd like to try and answer is how things are going. And it really depends on who you ask or who's speaking. This has been an interesting process to watch, and as I've mentioned in previous presentations, it has become quite political in many ways, quite sensational in many ways, and everyone seems to have an agenda, probably including me. And I'll show you an example where here you see the United States head and shoulders above everyone else. And I tried to highlight things for those of you who are watching either at home or after the fact, where we have risen to number one in the world. But presenting it this way is a very specific, it has a very specific intent. But it would be more honest to point out that our population exceeds that of the next five right underneath us: Spain, Italy, Germany, France, and the United Kingdom put together. And so you have to be careful when you look at data and make sure that you understand how it's being presented and probably why it's being presented that way. So I'm going to go back to something that I introduced in the last update, not to the City Council but online, that helps you understand where we're at. And I actually prepared this section about a week ago, but it turns out to be fairly premonitional, if that's a word, because I think it reflects the numbers pretty accurately. And so it takes about 5 days after you're infected with the virus to develop any symptoms, and another 5 days to get sick enough to where you present to the emergency department or are admitted to the hospital. Now, up until recently, that's been the point where we're actually sending tests, which take, or have taken about 7, even longer in some cases, days to get a result. So around the time that we would be getting a positive test is also around the time that a patient who's sick enough would progress all the way to death. And understanding how long this process takes and where the testing has occurred is key to understanding all of the data. Now, if we look at when California as a state imposed mandatory lockdown, that was on March 18th. And so 5 days from then would be the 23rd, and 5 more days to the point where tests were being sent would be March 28th, and then the point where those tests were being returned would be April 4th. So to see the results of something happening, what ends up being about 17 days earlier, we have to build that into our interpretation of all of these graphs. So if we consider just the idea of a positive test, which if the lockdown went into place on March 18th, we wouldn't expect to see an effect of that until April 4th. Now, my favorite website to look on is this one, and I've given the reference in the previous presentation. But it's the cleanest way to look at the data for cumulative cases that have been diagnosed using a positive laboratory test. And from these data, you can see the overall results in red, and then down below, you can see the daily results. And what we're really looking for is the curve to start to bend or flatten. And you get a sense that it's doing that on the top. If you really want to drill down and look at the daily rates, you can see for the entire country that really 4 days ago on April 3rd is when we saw the peak and it started to turn. So that actually went exactly along the prediction that I gave in the previous slide, that we would see our data start to turn around April 3rd or 4th. You can see our numbers are much higher in this graph than Spain, United Kingdom, Italy, Germany, etc., because it's being presented linearly, not logarithmically, and at the risk of boring all the non-mathematicians, that's one way that you can make things look more impressive if you present them linearly versus logarithmically. But again, we're seeing the data start to turn in response to the lockdown, and that is a critical thing to understand. that what we're doing as a nation has worked and that we've now turned a corner. Now, this represents daily new cases, and they're still going up, and they're still going up at a rate that exceeds all of the next 6 or 7 countries combined. So we are definitely not out of the woods by any stretch of the imagination, and our daily cases are going up. They're just not going up as fast as they were last week, and at least that reflects some progress. Now, it's important to recognize the heterogeneity of the United States. We are really like many countries, or you could say Europe is like the United States of Europe. But no matter how you slice it, it's important to consider that California is a little bit different than New York, which is different from the Midwest, which is different from New Orleans. And so we've also seen that in California, which pulled the trigger on isolation and social quarantining earlier than much of the rest of the country, that we've seen our new cases drop quite a bit. And just yesterday we saw for the first time our new cases dropped to 3 digits rather than 4 digits, which represents, I suppose, a sort of milestone there. So things in California are actually progressing even better than they are in the rest of the United States. And you can see that as compared to what's happened up in New York and New Jersey and all those other states there, that you really have to go all the way down to Washington State, which was the very first state to be affected, to see numbers that are as low as California, and we are the most populous state by a fair margin. Now, even within California, Northern California in many ways thinks of it as a different state and a different country and different species than Southern California. And so it's important to look at what's happening in Southern California, where maybe the bend in the curve isn't quite as easy to see, but if you squint your eyes a little bit, you can see that overall cases are starting to flatten out a little bit. So that's a positive thing, because the fate of Catalina rests so heavily on what's happening in Los Angeles City and how impacted the hospitals and particularly the ICUs are there. Now, what if we could look a little bit earlier in the process? Well, in fact, we can, because I'm also a medical director for the helicopters and for Riverside County Fire Department, and I have access to data from the Riverside Public Health Department that shows us what's happened with regard to flu-like illnesses in the emergency department. And that you can see, and this is a little bit harder to interpret because the numbers actually mean the weeks of the year, but I'll help you interpret it by pointing out that this represents the influenza pattern that we see every single year that was actually on its way down in early February, and then we see in the beginning of March another spike, a secondary spike in flu-like illnesses. Now, strangely, that also includes influenza again for some reason, but that's also where we started to see COVID appear in our emergency department visits. And you see that in week 13 of the year, which if I go back to the predictions would be around March 28th, was exactly when we would have expected those emergency department visits to drop. So far the data is following exactly what you would predict based on what we know about the virus. Now, ultimately, some of the epidemiologists are sort of giving up, saying it's too hard to interpret these other sources of data. If we look at ED flu-like illnesses, we're going to get a blend of influenza and COVID. If we look at positive tests, well, the fact that we've started sending more tests in the last 2 weeks is going to influence the number of positive tests, and we're finding out that some people who didn't really have much in the way of symptoms are testing positive, and so maybe that's influencing the spike that we see in positive cases. So let's just go straight to the bottom line, which is the number of deaths. And so if we look at the number of deaths in the United States, we see a similar pattern. Now, that should have been staggered by a week or two, because it takes a week for somebody who's admitted to the hospital to die. But the delay in testing and getting the results back is what's really made our death curve look a lot like our new cases curve. And that as we get better at testing and we get results back, in some cases even the same day, we'll see the number of cases spike earlier, and then a week later the number of deaths spike. And that's really why you've seen all these predictions on the news about how this next week or 2 weeks is going to be the spike in the number of deaths, because people being diagnosed now, and now that we're getting test results back faster, are not necessarily going to die for another week or two. But we're seeing the death curve start to flatten out, maybe not quite as dramatically. And here you see the number of new cases each day, but it does seem to have turned a corner a little bit. But again, the deaths are delayed behind the diagnoses a little bit. And so we're going to see the deaths continue to increase and maybe not plateau for another week or two. But again, California has stood out in that we have a fairly low rate of new deaths, even as recently as yesterday, as compared to other states, again, like New York, New Jersey, Michigan, etc. And so California is uniquely better off, and for that reason you saw the governor step forward and say, we have more ventilators perhaps than we need. Let's send them to other states where they're going to be needing them over the next several weeks, which I think immediately people were questioning, but is supported by the data that we have available. And if you look at the trajectory of California compared to the other states, it does seem to be flattening out, and it doesn't look like we're going to see this huge spike in deaths like some of the other states. And you can see how much farther ahead of us states like New York and New Jersey not having nearly the population that we have here in California, but that they're well ahead of us. And this is, again, a logarithmic curve. If we made this into a linear curve, it would look even more dramatic. So I think we're actually doing fairly well here in California. Now, what's been done here, and this is just a brief summary of things that I've covered in other presentations, but the hospital has been incredibly aggressive and forward-thinking in trying to prepare for an influx of patients that we hope does not come. And we've done that by partitioning off the different areas of the hospital, trying to decrease visits to the hospital and handle things as much as we can over the phone, having patients call in ahead of time so that we can correctly triage, and even setting up an infectious tent that's external to the physical plant of the hospital where we can handle most of the visits and certainly can do any testing that we need to do. And then I think we've also seen the hospital step up in more of a public health role, which I'll come back to in a moment, both with regard to communications as well as the idea that we are the source of testing and tracking and monitoring patients in the community. Now, while you've seen data from the United States, from California, and even from Los Angeles City, we can also, I think, take some solace and some satisfaction in the fact that this process that we've really developed on the fly in partnership with our colleagues at UC Irvine seems to be working. We were able to identify the positive patients that we've had here on the island in advance and take precautions so that no one was exposed in either what's defined as either a medium or high risk level, that the patients were able to be monitored at home, and the patient who required transfer was able to be transferred with minimal exposure to the community, but at the earliest possible moment to keep that patient safe and prevent further deterioration. So in that sense, it's been a dramatic success, given that this was not something that we had even thought about a couple of months ago. In addition, we've had dozens and dozens of patients who have been screened, and more than a dozen patients actually tested. And we've been able to do that without contaminating the hospital. We've been able to monitor the patients who have been tested remotely, and to make sure that there's been no deterioration in some cases while we're waiting for the results. And then we've developed a set of triggers to decide when to go out and take a set of vital signs and check oxygenation, when to bring the patients in for additional testing and care. And so again, all of this has been just in a very short period of time, but so far, with our opportunity to try this on several dozen patients, it seems to be working fairly well. The current protocol, which will likely change in the next couple of weeks, is that we will send tests on patients who have any two of the following. a fever with some kind of infectious symptoms, and we broadened that to include not just respiratory, but also to include GI symptoms, since that seems to be a presenting feature in some patients, and even the sort of strange one of a loss of taste and smell, or taste or smell, which seems to be unique to this particular coronavirus. Or if you are a member of the vulnerable population, either because you've traveled to a high-risk country or been in contact with a known positive patient, if you're a healthcare worker, then we have to assume that there's been exposure. Or if you're an older patient or have some comorbidity, including diabetes and immunocompromised condition, pregnancy, which is a relative condition, and any heart, lung, or kidney disease, then you only need one of the others. So any two of those three on the left-hand bullets would qualify you. Now, the likelihood is that we will be able to access point-of-care testing with a result back in less than 30 minutes in the relatively near future. And that just happened to be a fortunate coincidence that we were involved in a trial of a particular device that happens to be manufactured in South Korea and happens to be one of the same companies that developed one of the tests that were submitted for fast track through the FDA. So we have already ordered point-of-care testing and will be one of the first hospitals in California and the United States to be able to offer that. And that will allow us potentially to broaden these criteria and take a little bit more of an aggressive approach to the public health aspects of managing COVID. And so this is where I need to do a little bit of a sobering reality check, that this is probably not going to be something that will go away like we saw with SARS and with MERS, but that we are stuck with this for a little while. And I'll show you what's going to get us out of this in a couple of slides. But what we need to do in the meantime is treat this like fighting a fire. So I was glad that there was a discussion about clearing brush, because this sets us up perfectly for how we're going to try and handle this pandemic. The ideal situation is not waiting till patients present sick enough to be admitted to the hospital, and certainly not getting results back around the time of death, but to try to catch them at the initial onset of symptoms and potentially even go backwards to people who are exposed to known positive individuals and to test them early on, to really take a public health approach to this. And that is what they've done in Singapore so effectively, where you see in this graph that not only do they have symptomatic patients, but even asymptomatic patients who are found to be positive, because they were aggressively identifying known cases and then tracing backwards to contacts. And when you look at their website, they can trace things down even to private dinner functions and find individuals who test positive even before they have symptoms. That's what public health is supposed to be about, and that's where the United States will have to take a good hard look at our public health system once we get through this initial phase. But in the second phase, which I think will probably continue for a year or more, this is where we transition from putting out the initial blaze to detecting and extinguishing flare-ups. That is the best analogy that I can think of. And in order to accomplish this, we need to know that the blaze is out first, and that's why we're following all of these sources of data. We need that faster and available testing, and like I said, we are fortunate that we will likely have that within the next couple of weeks. And then we need to discuss the public health role of the Islands Medical Center. Now, for CIMC to step up and take this role is good for the community, but it really oversteps the bounds of a non-governmental entity. And we are exploring with public health how far we can push this, but we are not allowed to do the things that public health is allowed to do. And we are asked on an almost daily basis for things like names and addresses and exact numbers and data that would allow people to be identified when we're not allowed to do that. We can try and work with individuals who have tested positive and see how much data they're willing to allow us to share. But even that is starting to get a little bit dicey as far as whether that's something that the medical center is allowed to do. That being said, we would really like to take an aggressive approach as best we can. And so in many ways, we're dependent on the cooperation of individuals who do test positive in either allowing us to notify official entities like, for instance, the express boats, or having them notify individuals with whom they had closer contact, and doing the best we can. And so we're looking for guidance because the public health department is built around diseases like tuberculosis, which happen with 1 or 2 cases at a time, not with tens of thousands of cases, and they are clearly overwhelmed. Now, a third phase, and this is where I think there's been a lot of interest even today, is when we actually get something that can knock this thing down and we can move away from this idea that we need to be aggressive in tracking and tracing individuals. One scenario, which is the one everyone's hoping for but afraid to say out loud, so at the risk of jinxing us, COVID could disappear the way that SARS and the way that MERS did. Everyone agrees that's less likely because it is so prevalent in the community and in the world right now. But if everyone knocked it down simultaneously, it could be at such a low level that there's no longer transmission and it would go as quickly as it came. That's not what we're planning for. That would be certainly nice if it happened, but the most likely thing that will happen in a matter of months would be that we identify the right treatments that can at least lessen the disease and prevent the life-threatening secondary syndrome, the ARDS that you hear about on the news. We will probably get news soon about remdesivir as the clinical trials start to roll out. We get lots of small trials and lots of kind of case studies that always make its way into the internet and even make its way into popular health figures like Dr. Oz, and that puts the scientific community a little bit at odds with the popular sort of news medical community, for lack of a better term, because we all want there to be something out there that is available and that is going to suddenly take this disease out for good, and it just doesn't exist. There are a lot of promising avenues, and we have invested in at least getting an ample supply of the hydroxychloroquine. Remdesivir was removed from availability in order to perform these clinical trials, but the likelihood is that they could ramp that up very quickly if that turns out to be a useful agent. There are some newer medications that target a particular part of the immune system that seems to be involved in that transition to ARDS. And so there's a number of promising things that will then buy us time to develop a vaccine. Now, this is different than existing vaccines in that we really don't know how to make them. So you're seeing lots of different strategies used, not just the old-fashioned grow the virus, kill it with heat, and then inject it into your arm, because it takes a while to make that much, and we couldn't ramp up that quickly. But we're trying to use new strategies where we actually stick stuff into your cells and let your own cells make the proteins, because they can do it faster than we can grow it in a culture plate. And there's even someone suggesting that maybe the old TB vaccine, the BCG, may activate your immune system enough to knock it down so that if you do get it, you don't go on to the ARDS. So those are the most likely strategies with regard to vaccine, but they have to go through a very specific process, and it's frustrating for everyone to think that a vaccine's already being tested, but it's going to be at least a year before it gets out there, and that means we've got to go through another flu season where the coronavirus may flare back up as bad or worse than it is right now. Why not just put it out there? And the reason is because vaccines are not completely without some risk that needs to be vetted out before they're used widely. That includes activating the immune system perhaps in a non-beneficial way, or more importantly, there's a possibility that if your immune system learns what coronavirus looks like and you get it, not only will it not dampen the effect, it will actually amplify the effect. It's sort of a priming. So we need to know that this is safe, especially since we're using it in people who aren't sick. And then separately have to make sure that it decreases transmission. So the hope that a vaccine will emerge and be available before the next flu season is less likely than one of these other agents ending up being something that can at least lessen the symptoms, which is very likely, and we've already, again, begun steps to make sure that we have ample supplies as available. So I do have some submitted questions, but I also see that we're right up against the end of our hour. So we can either answer the questions online and use this as a teaser so that people visit our website, or if you want, we can certainly do live question and answer session. As long as you've got questions and you want to stay, I'll stand up here and answer them.
Well, you've only been about a half hour, so, and if you were given an hour, we have time for questions.
Well, if that's the case, then I have questions that have been submitted, and some good ones. Billy Simpkins says that he has a colleague who had an illness that seemed to last from even around Christmas time to the present, and finally got tested and was positive. Is it possible that this has been around for longer than we realize, and that perhaps we're going to be surprised when the antibody tests come back? It's an interesting theory. The way that it has spread so quickly through the community, it would surprise me if we actually had this in the United States as early as, and he speculates, November or December. So I would say it's more likely that person has had the usual crud that haunts us all flu season long, and then at some point along the way also then contracted coronavirus. But the idea that maybe some of us have been infected and we don't know it, and that we will eventually get to a herd immunity, the idea that once you get above 50, 60, 70% of people who have antibodies against it because they've seen it, either because they contracted it or because they were vaccinated, it makes it hard for it to exist anymore in that community. The best studies we have so far have been on healthcare workers using the new antibody testing, and have found that only about 6 or 7% of Dutch healthcare workers had antibodies. Many of them had very mild illness or no illness at all. So the idea that asymptomatic people may have become infected and developed an antibody response is a hopeful sign, but the numbers are not particularly high. Now, that was fairly early in the pandemic through Europe, and so maybe the numbers are higher now. And in fact, we also have ordered antibody testing. The problem is that you don't see the antibodies react until well into the illness, so it's not really very useful yet to help diagnose the syndrome, but it may be something that we use to figure out who is immune already. And it wouldn't surprise me if this summer we're all sorted into those who have antibodies and those who don't, because we don't have a vaccine. So the best we've got is saying you've got antibodies, therefore you are safer to work on the front lines, say in a hospital or say in Vaughn's, than somebody who doesn't yet have antibodies. So this is all kind of happening around us. This same person actually asked for some flu data, so I pulled some flu data for him to show us what influenza has looked like this year, which is in the red, that kind of looks like a W in the center there versus previous years. You see the last big year that we had in light blue there, kind of crouching over the top, although this was a fairly substantial year as well. This is in the number of emergency department visits. Here you see in people hospitalized, and so at this point you see 2019-20 as second on the list, with 2017-18 being the real big one, where not only were there a lot of people infected, but they were fairly severe. And then looking at deaths, where this is just looking, ending April 2nd there, and we're looking at the weeks of the years down at the bottom. So you see 2015, 16, 17, again 2017-18 had a spike in the number of deaths when we had a particularly virulent strain. Then you see 2018 and 19 where it looked like it was going to peak, and then it goes, it starts going up again. Now this is pneumonia and influenza, and so it's very possible that some of those secondary spike pneumonia deaths were actually COVID-19 that may or may not even have been recognized. Another question from Caspons8 at gmail.com is, has quarantine or isolation site on the island been established for those with positive results or exposed to someone with positive? So the first priority is to isolate in your home, but we have been looking at alternate sites if we become overwhelmed and are forced to keep patients on the island, which, knock on wood, I hope does not happen. But if we were forced to, we have several options for sites where we may not keep patients initially in their hospitalization, but as they improve, but are not yet well enough to be at home safely, that we would put them in sort of a COVID nursing home, for lack of a better term. Sounds like an awful place to go. And then this same person suggests that although the CDC recommendation is to isolate within your home and use separate bathrooms, this may not be possible for the majority. You've got to do the best you can, and I would really say that having to share a bathroom is not really the biggest issue, because you should be washing your hands even not in COVID times after you use the bathroom. Maybe now you start washing your hands before, but really the spread is not down into regions below your belt, but it's really to your face. So the most important thing is to wash your hands before touching your face, and certainly after you go to the bathroom would be a good time to remember to do that. I have had questions about the utility of gloves, and gloves really are not a big piece of this puzzle. The virus can sit on gloves just as easily as on your hands, and it really isn't pragmatic to sit and wash your gloves, and I'm not even sure they hold up to repeated exposures to some of the hand sanitizers. Your own skin is easier to sanitize than repeatedly trying to sanitize gloves. We wear gloves in the hospitals because we throw them away after every patient, and then we wash our hands again. But unless you are going to throw away your gloves after every person that you came into encounter with throughout your day, and certainly before you touch your face, then gloves are not as critical as masks, because that's how it's entering into your body. Anonymous asks, does CIMC have the capacity to support patients who have serious symptoms? And we have beefed up our ability to take care of ICU level patients. We now have 4 ventilators and even have the capacity to split those and ventilate multiple patients with each, although that is definitely not what we would like to do. And in fact, our current protocol is to transfer somebody as soon as they need hospitalization, so that we don't have to face the issue of supporting patients who are on ventilators. The nurses have received extra training on how to deal with ventilated patients and use the specific ventilators that we have, and we've beefed up on our monitoring equipment that would be necessary, as well as our medications that would be necessary for an intubated, ventilated patient. So I'm confident that we have the ability to take care of these folks, but this is definitely not our preference. And my hope, given the data, is that we will not see the Los Angeles hospitals get overwhelmed. Vicki Pierce asks, how long does it take to be notified if a person comes into contact with someone? And this is where we need to test the limits of how far we can go as a hospital that isn't a governmental entity. The strictest interpretation was we can't do any of that. We can certainly encourage patients to talk to anyone they came into contact with, and we may be able to contact some individuals saying that you have been around somebody who tested positive and that you ought to be tested if you have any symptoms at all. That's the kind of thing that we're exploring, as well as potentially notifying the boats, the businesses, etc. That was our second question about places of business. And the last is about patients over 60 are certainly at risk for more serious symptoms and fatal outcomes. Is it possible that they also could be asymptomatic? And absolutely yes. They run the gamut just like everyone else. And so it is likely that people, if we get to the point of serum testing, are going to be surprised that they tested positive and are thinking back over the last 2 months about every sniffle and sneeze, thinking maybe that was it. But it's also possible that you would have absolutely no symptoms whatsoever. So those are the questions that I have. Do you have other questions that have been submitted?
I do. I have a 4-part question submitted by one individual and a 2 or 3-part question submitted by another one. So Kathleen Carlisle asked, and I'll read each part of her 4-part question to give you a break.
By the way, I've been extremely impressed with the sophistication of questions that we get. This is definitely not a typical community population that asks these questions, and we've expanded this to include both English and Spanish language, and the questions are equally sophisticated from both, so I've been really impressed with the folks who are asking questions.
So Kathleen Carlisle asks, the first part of it is, CIMC has taken on the role of reporting cases. Thank you. We know this is not your job, but because of legal privacy laws, CIMC cannot disclose even general information about other cases. In other parts of the state, the county is able to say whether a case is known to have been contracted due to international travel or whether they believe it to be by community spread. But as of 4:40 p.m. today, LA County website still shows 0 cases in Avalon. How can we be assured that LA County is doing contact tracking if they have not even acknowledged the cases on the website yet?
Yeah, so that specific issue, so there's a lot of things to comment on in that question. I don't know if that was just one part of 4, and we're in trouble. But when you see notifications occurring, that is supposed to be occurring at the level of the public health department rather than at an individual hospital. We have worked with our legal counsel on what we are allowed to say, specifically to try and avoid, in a small community, people being able to put the pieces together. Social media has added a whole new challenge to this because people are very likely to share with their friends what they did during their day, including getting tested for COVID. And so oftentimes it gets out there through other routes, and I'm always amazed at how quickly the media can track down stories about the transmission of COVID. But you should not generally be seeing hospitals playing that role. That being said, it's a role that I think is important to try and play as best we can within our limits in this community because of what I talked about the last time I was here, the preponderance of older patients and comorbidities that we really want to try and protect them as best that we can. So we're doing the best we can from that perspective. Now, the reason that we haven't showed up on that map turns out that you need at least 5 cases to get your own red dot. And we are not at that point yet. I hope that we don't get to that point. But that turns out to be a quirk of the graphing program.
The second part is slightly shorter. Besides staying at home, how can we help? Do you still need us to call government officials about more PPE for CIMC?
Actually, we've been very lucky in that we almost get special treatment out here, and we've had no trouble either giving or receiving. The patient that we transferred was taken within 25 minutes, was off the island, which is the fastest transfer I've ever had here. And we've been receiving ample supplies. The team that's responsible for preparedness for COVID-19 was way out in front of the curve in acquiring the ICU level equipment and medication that I mentioned, and we've been able to get a hold of a lot of equipment that otherwise has been scarce until just recently. And so at this point, I think we are in really good position here on Catalina Island and in California in general, and I think that's why we saw the governor being willing to try and help out other states, even if his primary obligation is to the folks in California.
The next part of that question is, does Avalon Hospital actually have the means, the space, the special meds, the respiratory therapists, and trained ICU staff to put someone on a ventilator and then do special cleaning process to clean the room?
So yes, on all of those except the respiratory therapist. We have not had respiratory therapy here, but the physicians are emergency physicians and are trained in critical care, and we've been doing additional training with the nurses to make sure that they're familiar with these ventilators. We will be in a unique situation in that there will be ample physician coverage here, both from the scheduled emergency physicians as well as a backup plan that we have for additional emergency physicians. And so you will have essentially a physician working, or 2 physicians working with 1 or 2 nurses and handling all of the decision making as far as critical care goes. So we're fairly confident, and we have been able to get a hold of all the supplies, the monitors, and the medications to handle, and we're looking at the worst case scenario of being able to keep 5 or more patients on a ventilator for 1 or more days at a time, and that's the sort of rule that we came up with, which we hope we get nowhere near.
The last part of this question from Kathleen Hill, Carlisle, might be for Chief Krug, but can you please explain the plan and the backup plan for when our first responders become ill or need to be quarantined for 2 weeks? We only have so many paramedics, EMTs, hospital staff.
I can start the question and then hand off to him, because that was a question I answered on the website, and so without stealing his thunder, because in California there is a very tight-knit group of EMS medical directors that are all wrestling with these problems, and we actually as a group came out with criteria out ahead of the CDC, because the original CDC criteria were much too restrictive, in that if there was even a moderate exposure, that the person was on quarantine for a long period of time. And we were out in front in being able to say that an exposure who's asymptomatic is allowed to continue working, even if as long as they're wearing appropriate personal protective gear, in this case also protecting the patient, and that the criteria on allowing someone to come back into the workforce have gone from initially a 21-day to a 14-day to a 7-day, and we've even considered using some of the testing. And so what we've seen in California in general is that what started out as being a major impact on EMS up in Santa Clara area has become a relatively minor impact. Now, all of that being said, in my ground agency for which I'm responsible in Riverside County, we've been very aggressive at prophylactically placing personal protective equipment prior to patient contacts that may not initially have sounded like a COVID patient. Because if there's one thing we've learned, is that it's very possible that even someone with a stroke or a heart attack is actually a positive for COVID, that we've reduced our transmission rate dramatically, and I believe that that is similar to the process that they've taken here, but I'll let the Chief answer that.
Yes, Avalon Fire has the same model that all the LA area fire departments have gone to. Typically, or what we work now is a 3-platoon schedule. If members start to become ill and they have to be quarantined, we'll go to a 2-platoon schedule, so there'll be a crew that's off and a crew that's on. We'll augment that with full-time staff and reserves, and we can do that for as long as people are healthy, and people that are possibly quarantined can rotate back in when they're no longer ill. If we got to a point that we were so drawn down, then we would ask for assistance from the mainland for other LA County, Long Beach, Area F, for firefighters to rotate from the mainland in so we could maintain service.
Great, thank you.
Thank you. The next, it's a 3-part question, is done by Carl Johnson. The first part of this is, it has been said since the beginning of the pandemic that the landscape is constantly changing around COVID-19. How does the City of Avalon determine the true extent of COVID-19? Besides HIPAA, how is it decided information should be shared and when to share it?
Let's see. Were those all 3 parts?
No, unfortunately.
Oh, okay, that's just part 1?
Part one.
Now, again, the ideal way to do public health is to chase not only the positive cases, but to then go backwards to people who are asymptomatic. And that, in general, has worked very well for most infectious diseases, because transmissibility follows symptomatology. So, for example, you don't become contagious until you're coughing and have a snotty nose. This has been a little bit challenging in that transmissibility or contagiousness seems to occur even before there are symptoms. But the fortunate thing is that the most efficient way to transfer it is to cough or to sneeze or to wipe your itchy nose and then shake someone's hand or touch the doorknob. And that in that early phase, it really takes very close contact. So we are still hopeful that by point of care testing and being able to tell someone who has symptoms within half an hour that they are positive or not for coronavirus, and then offering to test, which is all we can do unless we're somehow given additional authority by public health, offer to test anybody with whom that person came into contact even before they have symptoms, that's the most aggressive way to try and identify and isolate anybody who might be contagious. And it appears that even the social isolation is working to reduce the spread, that taking that sort of an aggressive approach, which is similar to what they did in Singapore, will even further limit it. So that's our best strategy right now. But it really is the job of public health, and we just don't have a big enough public health department anywhere in the United States to truly do it the way that it needs to be done. So I hope that any of you who are watching this would be willing to work with us to try and identify and then ultimately test any close contacts. This is not a time to be to try and withhold things because it'll make you not look so good, or that you'll get blamed for transmitting it. In many cases, the transmission will occur while asymptomatic, so it's really not that person's fault. And they need to participate in the process of helping identify potential people exposed and then get them tested as well.
Michael, before you move on, in conjunction with what you're saying, I think there's some misinformation out there that if I were potentially in contact with somebody who ultimately tested positive, and I go to get tested and my results come out negative, that does not mean that I am negative for the rest of my being. That means that with that particular person, I may not have been exposed by them, but that I may be exposed tomorrow by someone else.
Yeah, so that brings up two really important points that I was waiting to see if someone was going to ask, but somebody did previously submit online. Why don't we just test everybody and then shut down the island? And I think, the island very quickly divides into those who depend on tourism and those who don't, as far as how they fall on that line. But even if we could identify everybody at this moment who tested positive, there would be two issues. Today's negative test doesn't guarantee tomorrow's negative test, because you may come into contact with someone who is infectious. But even if you shut down the borders and locked us all into a bubble, the test early in the illness is not particularly sensitive, that we're going to miss a third or more of people who may actually have coronavirus but are not resulting in a positive test. We don't know exactly why that is. If the virus immediately goes down in and you're not shedding it as much until you actually have so much in you that it's oozing out of your pores, for lack of a better term. That's probably sort of what's happening, is that unlike a virus that likes to stick in your nose and hang around boogers and snot, that this one is using your nose and your mouth as a portal of entry, but is going inside. And so swabbing at that moment may or may not reveal the presence of that virus, and there has to be a sort of a cutoff point for a positive test, just like a pregnancy test. So that's actually a good analogy, is to think of it as, the day after there's conception, you're not going to have a positive test. In fact, that won't be positive for a couple of weeks. And that's kind of like it works here, except that you may be transmissible or infectious even when you don't have a positive test. And that's really frustrating, that you can give it to somebody, but we can't find it on a test. That makes this job a lot harder. And again, we don't completely understand why that is, because it's not supposed to happen that way. But that's an excellent point, so that we're not going to just test everyone, because we'd have to test every week or every other day to really keep tabs. And even then, the test is imperfect.
And we don't want to do that because of I'm just sort of laying this out there because you guys told me this, that we don't want to just test everybody every week just to see who gets it when they get it, because the length of time, we would just be like millions of people stopping up the entire system, and those people that really need their test to go through to find out while they're needing medical care, we need that capacity for them to get their test through. So even though we don't have any symptoms, it doesn't make sense to go and test everybody, because we don't want to lock up the system.
Yeah, just yesterday on the evening news, or you saw the mayor of Los Angeles say that now anybody can apply for a test. And within 30 seconds, the anchors twisted that into anybody can get tested. And that's not what he said. He said anybody can apply for a test, and they're still going to either apply the screening criteria, which are going to look even more conservative than what I showed you for our medical center, or you go to the end of the line, and when they have some leftover tests, then maybe you'll get called to get your test. And so until we have so many tests that you can go to Leo's and buy your over-the-counter test and test yourself, just like you could with a pregnancy test, then there's going to be some limit imposed. And right now, the most aggressive strategies are what you're seeing that we're offering here. And then when we get point-of-care testing, to be even more aggressive, to start looking at contacts in people with relatively minor symptoms.
So the other part of that, this is 2 of 3. With limited testing, only 14 tests conducted and 2 confirmed cases in Avalon. How many people in Avalon have been quarantined due to known contact or exposure to someone with a confirmed case of coronavirus? How many people in Avalon have been quarantined with symptoms of COVID-19 but have not been tested?
Those are good questions. I can answer the first one definitively because there was nobody who came into contact with the positive individuals who had a high enough risk exposure to warrant empiric testing. With regards to people presenting with flu-like symptoms, if you recall from the last time I was here a few weeks ago, at that point we were only testing people who had fever and respiratory symptoms and were considered vulnerable. And now we've turned it into a series of ORs. And so there were probably, if I had to guess, at least 36 people presenting either to the clinic or the emergency department asking if their upper respiratory symptoms could possibly be coronavirus, and being either run through the screen and told at this point you don't meet screening criteria, but let's watch you. And so getting routine checks to see if the symptoms are improving, or in some cases with an alternative diagnosis like strep throat or sinusitis, to see if there was an immediate response to antibiotics, and deciding that because there had been a response, we're not going to do testing. I would estimate that's probably in an additional 3 dozen, maybe more than that, if we include those folks who were treated for things like sinusitis and mild upper respiratory symptoms. Is it possible that some of those folks actually had coronavirus? It is definitely possible, because it's possible that people are asymptomatic with coronavirus. And so there's a lot of possibilities right now, but there's limits as to what we can do. And I think our best strategy is going to be to gradually loosen criteria as testing becomes available, and then try and encourage that testing of exposures, at least close exposures. And the CDC has fairly well-defined criteria for what constitutes a high risk, a medium risk, and a low risk exposure. And we can use those criteria to help decide then which contacts need to be tested, as opposed to waiting for people to develop symptoms and come in for testing.
And the third part of that question, and this is the last question, now that transportation has finally been limited and can be enforced, testing every person in Avalon must happen to get ahead of the curve. We know that there is no telling the extent of COVID-19 in our community until testing is available to everyone, and I mean every single person on the island. When will testing be available for everyone?
But it sort of revolves around the same issues that we're talking about. And again, I don't think it will ever be a reasonable strategy to routinely test everyone on the island, because again, it would have to occur at regular intervals, and you're still a risk of exposure, particularly once tourism returns, assuming that there's still some incidence or prevalence of the disease in the community. Again, I think the most rational use of the resource that we have is to identify patients with relatively minor symptoms and test them on the spot with a point-of-care test, and then go backwards to identify higher risk exposures, or medium and high risk exposures, and test them even when asymptomatic, knowing that they still could be infected and the test is just not sensitive enough. But that at least focuses the testing rather than trying to expose a large population of people at some kind of regular interval that really wouldn't be sustainable financially and doesn't make a lot of medical sense. And that's what an epidemiologist would recommend as well.
That's all comments I have.
Go ahead. No, go ahead.
Is there any data to suggest how long you can be contagious, or at what point? Like, obviously, you can be asymptomatic and be contagious, but after if you contract COVID-19 and you have run your cycle and come through it blessedly, then how long are you still contagious?
Well, so that is I was going to say $1 million question. It's probably a $1 billion question, because this gets to the heart of when it's safe to send somebody back to work after they've been, tested. Up until now, it's even been suspected but not tested because the testing wasn't available. There are reports saying that you can identify the virus in mucous membranes out to 21 days. However, it's unlikely that you would be transmissible or that you would be contagious after, and then the number has slowly gone to 14 days, now 7 days, now maybe just 3 days without symptoms. And maybe if you wear a mask, you can mitigate some of that risk. It's more important to maintain staffing for essential vocations like healthcare, et cetera. And so maybe for them, we have to get people back on the front lines. And so if we just have them wear masks, that mitigates the risk of transmission from the healthcare provider to the patients. But that number is being heavily influenced by economics as well. The safe thing would be for people to stay home for several weeks, but they may not be able to afford that. And their business may not be able to afford, paying them if they're sitting at home. And so all we can do is mitigate risk. And so the best protocols I've seen now are to allow people to go back after 7 days or with 3 consecutive days without symptoms, and then wear a mask for another week at that point. And we've actually used that on some of the people that we weren't able to test early on, saying, why don't you just wear a mask because you are out with the public, and just eliminate the risk, or at least reduce it as best we can.
And there's still no data to indicate whether or not you can contract a second time, correct?
There are no data. The best guess, if you follow other coronaviruses, is that you get at least a couple of years of immunity. And so that is our hope, and that's why antibody testing is one of the strategies in which we'll invest. The things that will throw a wrench into that are if the virus routinely mutates, so that when you were sensitive to the one last year but not this year, sort of like what we see with influenza. That's not exactly the way that coronaviruses typically work. They don't mutate quite as much, or at least you don't see that constant shifting that you get with influenza. But because it's an RNA virus, which is just one strand instead of DNA, which is 2, it's more prone to mutations, and that's how we got here in the first place, and that's why the SARS and the MERS and this version are RNA viruses, are coronaviruses. So everyone is very nervously thinking about, when we get through this, how are we going to prepare for the next one? Because it's going to happen, and whether it's going to be the same strain that mutates or another one waiting out there, how are we going to ensure that we have a better response and we don't essentially get success with the same things that we used in 1918 in the Spanish flu, where all we did was isolate and let it kind of pass through in the first wave. So those are the right questions, and I wish we had better answers.
And one more question. Is there any recommendations that you would give to our community as far as better preparing themselves in terms of, a healthier lifestyle, additional vitamins, or, better health care, home care? Is there any recommendations?
There's nothing that has emerged that you can do right now. I think we are going to learn that there are some very strong genetic predispositions either to getting the illness and certainly to developing the secondary kind of ARDS thing. It's too tantalizing to see some countries and some ethnicities affected disproportionately to not think there's something genetic there. So we may be able to identify risk factors. It's kind of a bummer if you happen to have one of those risk factors but can't change it. It would be much easier to say to go out and, and stock up on vitamin C or eat vitamin C rich foods. There's a lot of things floating around the internet. None of those are anything that anybody is willing to back at this point. Going forward, I think there's going to have to be a change in the culture in the United States to accept that we need to routinely prepare for these sort of things. This idea that we have felt somehow entitled or that this will never happen here because we are the best prepared and we had a B+, higher than any other country on earth as far as preparedness for a pandemic. I think that notion has been dashed, and that just like here in California, we are perfectly willing to support our fire entities, or at least right now in the wake of a series of fires, to say it's going to happen again, we need to be ready for it. I think we need to take the same tact when it comes to an infectious illness and have to accept that a certain percentage of our budget, and they've been comparing it to the military, has to go towards pandemic preparedness, and that we need a whole infrastructure, probably one that involves the military, and that we just have to be ready for that and be willing to support that when the time comes. At this point, it's easy to sort of throw money, but we're playing catch up at this point, and I think the real decisions are going to be when SARS-2, which is what we'll end up calling this, passes, and we're trying to save money to prepare for SARS-3 when we may be facing 10 years of a recession as a result of our response to SARS-2, and it won't be popular to start to lay money aside for SARS-3. So I don't envy the politicians coming out of this.
Thank you.
If no further questions, once again, I want to thank you. You do an incredible job. Incredible job. So, yes, thank you. Okay. Oral communication. This is an opportunity for people out in television land to, I guess they can call in.
No, it's still through the e-commerce.
Okay. You can type in. We were limiting this to non-agenda items and no action will be taken. And you'll be limited to 300 words. No, 3 minutes of words. Thank you, Jordan.
Do you have any, Michael?
I do. I have 3 comments. The first one is from Yolanda Say. She writes, "Good evening, Council. I'm extremely concerned for the safety of Vaughn's employees and the residents who shop there. I'm hoping that there can be some guidelines from the city, such as allowing a certain number of shoppers in at a time for social distance, as there is so many people are in there at one time, it is not safe. Employees and customers should all be wearing face coverings for protection of all and sanitizing in between customers or every 15 minutes.
I know this morning, Brian Riley from Vaughn's on our 9 o'clock call said that, I think he said just about every one of his employees today was wearing masks, and going forward, I believe he said that he couldn't mandate them to do that. It was just strongly encouraged. Is that correct? The rest of us that were on that call?
Yes.
And as far as washing hands, I can't remember how often he said that they were washing their hands.
I think her question was
30 minutes or
sanitizing. So they
You said every 30 minutes, or?
Yeah, they have been. And Brian did report that nearly 100% are now in masks after having further conversations this week. And that there's wipes, there's spray, There was somebody out front day before yesterday spraying carts down and cleaning and wiping them down with a sanitizer. So that is now happening.
But there is a limit to his staffing and being able to be there with every cart. And I have found that when you go into the store and you get your cart, get that hand sanitizer, use it then, and when you leave, sanitize it again, and then it's ready for the next person and your hands are clean again.
And they also had gloves there.
And they also have gloves. And there was a comment he made about with the square footage of that store. Remember that like 100 people or something, the square footage of the store that Vons or Albertsons, whatever, has not regulated that.
The formula that they use for the mainland, that we haven't hit that capacity in our store.
Yeah. Yeah, he said, by the way, yeah.
I do believe up until a week ago there was a lot more traffic in the store, but now it has subsided substantially where it is not. But still a good reminder that, you know, as much of a bummer as it is, going to Vons is not a family outing. That choose one person in your home at any given moment. And if you, you know, if you are a single parent with a small child who you can't leave at home, you know, that's one thing. But we are still seeing families going out and families thinking that this is a great opportunity to get out of the house. It's not.
Yeah. Thank you for reiterating that. Okay. What else you got?
The next comment comes from Mark Tasca. He writes, and there's a couple questions that's a part of this. Had a conversation with Captain Hawking and Mayor Pro Tem. They couldn't provide an answer. Can we punish those who violate the social distancing 6-foot rule, even those that aren't related? And then he also writes, the state of Texas are stopping people from entering into the state from out-of-state plates or those that own a second home from entering. Could we do the same as the state of Texas to deny those people who don't live here 24/7?
Well, we have a city attorney that can respond to the 24/7, right?
You can, yeah, the law is quite clear that you cannot bar people from coming over to Catalina for essential business purposes. So if it's in one of the exceptions in the governor's order or the County of Los Angeles order, they are allowed to come to the city.
And that first part of that question, Michael?
You're going to take it?
It says,
violation. Okay.
Yeah.
yep, there you go.
And yes, I do have an answer for that. And there is a county code that we can issue citations for a misdemeanor, or we can make an arrest. So it's very easy for us to go out there and arrest everybody that's in violation of it. But we don't want to do that. What we're trying to get is the people to comply. We listened to this doctor for over an hour tell us what we should do, and that's what we need to do to keep this thing. So we do have an answer for him.
I think in all fairness, and I wasn't prepared for the question at the moment that Mark spoke to us on the street, but you know, we're a small community. We all know each other, and it's sort of the letter of the law and the spirit of the law. The letter of the law is, I mean, there's been people who haven't socially distanced just walking by and doing different things in this room. Are we going to arrest everybody? No. We're trying to ramp this up to say, hey, everybody, please pay attention to the rules, you know, and please follow them. I don't particularly want to direct the sheriff's department to go start arresting people and writing all these tickets, even though it may be good revenue for the city. It just doesn't feel good to do that. So we've been slowly asking people, you know, I've stopped people on the street and said a few things. You know, I've been called a few names, and I've been, you know, called the Paw Patrol and all of that, but it's a matter of, you know, trying to get the information out there that, hey, you're putting us at risk because you and your buddies are playing basketball. You know, you're at risk. You're putting the rest of us at risk because you guys aren't following the same rules that everyone else is. But I don't necessarily want us to go start writing citations to everybody. It just doesn't feel good. So just follow the rules.
Additionally, I'd like to say that the county directive, as well as the conversation or the conference calls with LA County sheriffs, is that they are asking the sheriffs to warn and to speak to people that seems to be the deterrent, that they didn't want them to come in heavy-handed, and this is from the county also, that to start to cite people immediately. That was their directive. Is that correct?
And one of the reasons for that, this is new to all of us. Okay, there's people that are scared, they're afraid they're going to catch it. Everybody should be, and that's why we need to listen to that doctor. We need to social distance ourselves, wash our hands, not have everybody touch the microphone. I saw that the microphone was cleaned a while ago. That's what we need to do to protect it.
And I'm sorry, one last addition to that you and I have spoken about is that that you guys are paying attention and taking names of the people that you have warned, so that if you are doing multiple warnings, that you may make that choice.
By all means, we sure can, and we can write a report and then present it to the district attorney's office. Thank you.
Great, thank you.
The last comment that I have is from Carl Johnson, and he writes, "Thank you for being here and thank you for everything you are doing. Thank you for hearing our cries by limiting transport on cross-channel carriers and being able to enforce. I really do hope that enforcement follows. With that being said, I do not agree with the current format of city council meetings in regards to the following statement. Quote, for public comment and questions, it is advised to submit in advance using the e-comment feature found at www.cityofavalon.com/meetings, end quote. I do not believe that this allows the people of Avalon to speak at one place that they can have a voice on their record. I am optimistic to see how this works, and I hope that limiting the people to speak in the moment does not continue. Maybe have a 5-minute mute period between items to ensure people have ample time to draft their questions, especially if there is lagging, or allow an extended Q&A session before calling a vote that is open to any and all items to be readdressed. I, for one, might not have a specific question on a specific item until I have heard everything that is spoken on a specific item, whether it be oral communication, consent calendar, public hearing, or general business. I respect the social distancing requirements, but I still think it is unfair and does not allow the people to speak. We are not restricted from speaking live when normal meetings take place, so I would encourage you to find a way to allow this to still take place now, please. We have the right to speak up at any meeting, and if our right is limited, then the meeting should be reconsidered. Thank you." He also writes, in regards to public hearings, "I would like to make note that this is the perfect example of the comment that I previously made during oral communication. I'm not able to formulate my question or statements with enough time to submit them while I'm watching the question statements that have already been addressed in the live stream. You see, I had to formulate this in advance, not knowing what you will or will not address. Not to mention the fact that I tend to have more questions after I hear what does not get addressed. I'm hoping that if I have further questions during the live stream that were not drafted in advance, that I will have enough time to present my questions before the meeting's closing. Thank you."
I have a couple comments I'd like to make to Carl, that I 100% agree with you that the public has the right to make comments and ask questions during agenda items. I ask that the public bear with us, please, as we go through this, and I look forward to the day that the public is invited back into our chambers to be present to ask those questions. We did send out like a listserv to city clerks and to cities saying specifically, what are you doing to allow the public, and we're we're getting all their input, and we're doing the best that we can. I'm sorry it's frustration to the public. And I know that there's a lag time of a couple minutes in between, so maybe our next council meeting we'll see what we can do to address some of Carl's concerns.
That's all I got.
Okay, thank you. Consent calendar.
We have 4 items this evening on consent calendar. The first one is actions from the regular city council meeting of March 17th and the special city council meeting of March 25th. We have expenditures for a total amount of $1,245,848.98. Number 3, this will be a second reading of an ordinance, and it's to adopt the ordinance of the City of Avalon amending Section 4-4.1703 of Article 17 of Chapter 4 of Title 4 of the Avalon Municipal Code pertaining to autoet permits associated with ADUs and junior ADUs. Number 4 is to adopt the resolution reciting the facts of the 2020 presidential primary general municipal election, which we held on March 3rd, 2020.
And just for clarification on the Ottawitz, that they will not be permitted.
That is correct.
I'll make a motion to approve items 1 through 4.
Second.
Been moved and seconded. Call for the vote.
Where's my
Sorry.
All in favor? No opposed?
Okay, we have a public hearing.
Wait, we have to have a roll call vote on all votes today because we're doing it because the public cannot be there at the meeting, and this is being somewhat done telephonically. So if we could have roll call votes for everything, thank you.
Thank you.
Thank you for the reminder, Scott. Mayor Marshall?
Aye.
Mayor Pro Tem Cassidy?
Aye.
Councilmember Olson?
Aye.
Councilmember Hayes?
Aye.
Okay, we would like to, we have a public
We
hearing.
have a public hearing, and I have to have Armina Saint from Metro. She's normally the one, all the years that I've been here, has come to the city council meeting and read into the record, so I've been provided the exact wording, and you'll have to bear with me, it's about 3 pages. And I have her on speakerphone right now, and she has to listen in because she has to do her job. And then she'll be there if anyone has any questions.
Okay.
Armina, are you there?
Here.
Okay. Good evening. The public portion of this meeting is held to hear testimony regarding the allocation of Transportation Development Act, TDA Article 8 funds. The California Transportation Development Act, enacted in 1972, provides the major source of state funds to support public transit services. 1/4 of a cent is collected as part of the statewide retail sales tax in this county and placed in a local transportation fund, TDA 3, 4, and 8, which is used to support public transportation within the county. The TDA funds are divided as followed. TDA 4 recipients receive 91.4%. TDA 3 is capped at Armina, did you have something to say? TDA 3 is capped at 2%, and TDA Article 8 receives a 6.6 share. By statute, most of the money, the 91.4% share in Los Angeles County, goes to support the operation of our regional bus service, Metro, and the municipal operators such as Long Beach Transit and Santa Monica. These services are funded in part by TDA Article 4. Additionally, some of the funds are used to support facilities for pedestrians and bicycles. This is known as TDA Article 3 for the 2% share. Article 8 of the TDA requires that a proportional share based on population, approximately 6.6% share of the sales tax revenue by allocated...
She got a dog there or something?
Armina, are you telling me no? Armina, are you there?
I'm sorry, I can hear her yeses and no's. It's funny.
Okay, continuing. 6.6 share of the sales tax revenue be allocated to these areas in the county that do not have Metro service because they are located outside Metro's service area. These areas are in the Santa Clarita Valley, the Antelope Valley, and Catalina Island. Transit needs can reasonably be met through an expansion of existing transportation systems, by establishing new systems, or by contracting for services. However, if there are no unmet transit needs which can be reasonably met with these funds, the funds may be used for local, public streets, and roads purposes.
I'm on mute.
No, I have you on speaker. Armina, you can't hear me? I don't know what to do.
Keep going.
Keep going. You know what the answer's going to be.
While the purpose of these hearings is to determine how TDA Article 8 funds should be allocated, your testimony about transit needs may be useful to local decision makers who are, I have it on full too. Your testimony about transit needs may be useful to local decision makers who are planning possible uses for Proposition A, Proposition C, Measure R, and Measure M funds. The Los Angeles County Metropolitan Transportation Authority holds a public hearing each year to determine what transit needs exist in your community before recommending how these funds should be allocated. The LAC MTA staff will compile your comments along with the comments made at all the hearings, including written comments received before the deadline. The Social Service Transportation Advisory Council, composed of local residents and social services providers, will consider your comments and make a recommendation to the TD8 Article Hearing Board. The hearing board will make recommendations to the full LAC MTA board. The board will act in June or July to make the findings about the use of TDA Article 8 funds in your community. The board's recommendations will be forwarded to the state in Sacramento for review and approval. If you wish to submit written comments in addition to or instead of testifying verbally, the record for all hearings will be kept open for 2 weeks after the conclusion of the public hearings. Written comments must be received by April 21st, 2020 for all affected areas. Your written comments should be submitted to the following address: Armina Saint, TDA Article 8 Hearing, Metropolitan Transportation Authority, MS 99-4-3, 1 Gateway Plaza, Los Angeles, California, 90012. Her email is sainta@metro.net. The public testimony portion of the hearing will now begin. Please remember to state your name and any organization you represent. So the public hearing is open, and if there's any comments.
No public comments.
Did you have any comments? Okay, public hearing is now closed.
Armina, the hearing's closed. We'll give her a copy of the tape. Don't know what else to say.
Oh, gosh, okay.
Okay.
On to general business.
All right. First item on general business is presenting a proclamation to our exiting officers. And I know that Annie and Cindy will be presenting those proclamations.
Do you want them to stand up there?
This is going to be so different this evening, yes. And I'm sorry to our exiting council members and to our incoming council members that you're unable to have any of your family members here with you this evening.
So you're going to go up there with Steve? Councilman Hayes?
6 feet apart.
Oh, okay.
You're right.
Can I look at you though? Okay. This is a proclamation of the City of Avalon honoring Stephen Hafes for his service as a council member of the City of Avalon. Whereas on July 2nd, 2019, the city clerk administered the oath of office to the newly appointed city council member Stephen Hafes, and whereas Steve sat on the City of Avalon's Audit Committee and was appointed to the Revenue Generating Ad Hoc Committee and participated in discussions on the Transient Occupancy Tax Ad Hoc Committee, and whereas Steve served on City Council because he believed he had the ability to facilitate changes that would greatly benefit our community. Steve has been committed to protecting and serving our citizens. And whereas, in addition to his dedication to civic leadership, Stephen is also a fervent advocate for public safety, having worked for the City of Avalon for 25 years, including serving as fire chief of the Avalon Fire Department for 10 years and serving 4 years as part-time city manager. And whereas Steve's experience managing both the fire department and the City of Avalon gave him firsthand experience in leading and working with a variety of people and organizations for the betterment of our community and making critical decisions under pressure. Whereas Steve has a deep understanding of the history and uniqueness of our community and all our small town has to offer. Therefore, the City Council and the citizens of Avalon extend our sincere appreciation and gratitude for Stephen for his contributions to the community and dedication to the continual improvement of the City of Avalon. Dated the 7th day of April 2020. Signed by Mayor Ann Marshall. Thank you.
No hugs, no kisses. You want to go get hand it to him, though? And now it's my turn? Okay. A proclamation of the City of Avalon honoring W.F. Ole Olson for his years of service as a council member of the City of Avalon. Whereas W.F. Ole Olson has served as a council member on the City of Avalon City Council for the past 8 years during his second tenure, and whereas during his 2 terms on City Council, Ole has sat on the City's of Avalon's Audit Committee and as chairman of the Avalon Municipal Hospital Board of Trustees. And whereas Ole served on a League of California Cities Revenue and Taxation Policy Committee, currently the Environmental Quality Policy Committee, and as chairman of the Community Services and Policy Committee. And whereas while Ole served on City Council, the Council accomplished large tasks such as the reopening of Pebbly Beach Road, artificial turfing of Joe Machado Field, implemented noise testing of golf carts, approved the building of the new lawns, directed the Finance Department to complete annual audits, imposed the private sanitary sewer laterals inspection program. Did you forget about that? Helped remove Avalon off the Hill to Bay beach bummer list, and worked with Southern California Edison to receive an additional desalination unit to hold off stage 3 water rationing. And whereas Ole graduated from Avalon School and has been a homeowner in Avalon for almost 40 years. And Ole, along with his wife Kate, raised their 2 children in Avalon, and they successfully owned and operated businesses such as Abe's Liquor Store, Catalina Island Vending, and followed in the footsteps of his grandfather, managing the Santa Catalina Island Company hotels. And whereas Ole has earned the respect of all of us who he has come in contact, and is a tireless advocate for the community who is always available to address any of the city's many challenges whenever the need arose. And lastly, he has maintained high standards and implemented policies that create a more efficient and productive city government. Now, therefore, the City Council and the citizens of Avalon extend their sincere appreciation and gratitude to Council Member Ole Olson for his contribution to the community and dedication to the continual improvement of the City of Avalon, dated today's date. Thank you very much.
Thank you. Someone got a long memory.
Probably Denise.
Mayor, you don't get an exiting one because we're going to swear you back in.
Okay.
Okay.
You're doing that first, I guess?
Yes, we'll be swearing in the new officers.
And do you want to start the file?
Thank you, Stephen. Thank you, Ole. It's been a pleasure.
No, I just want to move to your seat.
The next section of the agenda is the seating of the newly elected officers, and we'll be swearing in the new mayor, and then we'll be going down as they appeared on the ballot. It will be Lisa Lavelle and Yesenia, and then Michael Ponce. Chief Craig, can I have you use your camera and your phone to take pictures of what you... So, Annie, I'm going to sit so I can read the oath to you and that you're going to repeat.
Please.
So I'm going to have you raise your right hand, and after I say I, you'll repeat everything that I say. So I
I, Annie Marshall,
do solemnly affirm
do solemnly affirm
that I will support and defend
that I will support and defend
the Constitution of the United States
the Constitution of the United
and
States
the Constitution of the State of California
and the Constitution of the State of California
against all enemies, foreign and domestic,
against all enemies, foreign and domestic,
and that I will bear true faith and allegiance
and that I will bear true faith and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California.
and the Constitution of the State of California.
I take this obligation freely,
I take this obligation freely,
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion,
and that I will faithfully discharge the duties
and I will faithfully discharge the duties
upon which I'm about to enter.
upon which I'm about to enter.
Welcome, Mayor.
Thank you very
I'd
much.
shake your hand, but we
No,
can't.
that's okay. Thank you.
And then Lisa Lavelle. Lisa, you're going to raise your right hand. Same thing. After I say aye, you'll say your first and last name and then repeat. So I,
Lisa Lavelle,
do solemnly affirm
do solemnly affirm
that I will support and defend
that I will support and defend
the Constitution of the United States
the Constitution of the United
and
States
the Constitution of the State of California
and the Constitution of the State of California
against all enemies, foreign and domestic,
against all enemies, foreign and domestic,
and that I will bear true faith and allegiance
and that I will bear true faith and allegiance
to the Constitution of the United States
to the Constitution of the United
and
States
the Constitution of the State of California.
and the Constitution of the State of California.
I take this obligation freely,
I take this obligation freely,
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion,
and that I will faithfully discharge the duties
and that I will faithfully discharge the duties
upon which I'm about to enter.
upon which I'm about to enter.
Welcome.
Thank you.
Yeah.
Do you want to pull off, there's two names and then put these up.
Yesenia.
So I
Yesenia Said de la Rosa,
do solemnly affirm
do solemnly affirm
that I will support and defend
that I will support and defend
the Constitution of the United States
the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the State of California
against all enemies, foreign and domestic,
against all enemies, foreign and domestic,
and that I will bear true faith and allegiance,
and I will
bear true faith and allegiance.
Sorry, a little nervous here.
I will bear
true
faith and allegiance
faith and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California.
and the Constitution of the State of California,
And I take this obligation freely,
and I take this obligation freely
without any mental reservation
without any mental
or
reservations
purpose of evasion.
or purpose of evasion,
And I will faithfully discharge
and I will faithfully discharge
the duties upon which
the duties upon which
I'm about to enter.
I'm about to enter.
Welcome.
Michael, where did you put Lisa?
I don't know. She's next, followed by Yesenia and then Michael Ponce.
So they, you can sit wherever she wants?
It's where
First come, first served.
Michael Ponce. And I'll have some likes in a minute. So
I, Michael Ponce,
do solemnly affirm
do solemnly affirm
that I will support and defend
that I will support and defend
the Constitution of the United States
the Constitution of the United
and
States
the Constitution of the State of California
and the Constitution of the State of California
against all enemies, foreign and domestic,
against all enemies, foreign and domestic,
and that I will bear true faith and allegiance
and that I will bear truth, faith, and allegiance
to the Constitution of the United States
to the Constitution of the United
and
States
the Constitution of the State of California.
and the Constitution of the State of California.
I take this obligation freely,
I take this obligation freely,
without any mental reservation
without any mental
or
reservations
purpose of evasion,
or the purpose of evasion,
and I will faithfully discharge
and I will faithfully discharge
the duties upon which
the duties upon which
I'm about to enter.
I'm about to enter.
Welcome back, Michael.
Thank you.
I got to sneak those as you there. Michael's got to hear I got five.
I went down to everybody's area. But it does not hurt to do it again.
Yeah.
Okay.
Now we need trash cans for all this stuff. So now they say in all the cities, now everybody's throwing their gloves and throwing their wipes and throwing them on the ground, and then that's another problem. Create one solution, it creates another problem.
Okay, on our agenda, we are on item 8, which is appointing of a mayor pro tem. So we will call for nominations now for mayor pro tem. If there is more than one nomination, voting for those nominated will be conducted. The person receiving the most votes will be declared mayor pro tem.
Well, I'll start the bidding. I would like to nominate Mayor Pro Tem Cindy McGugan Cassidy. She's done a great job, and she represents our community very well and is extremely well-spoken, so I would like to nominate her.
I'll second it.
It's been moved and seconded. We'll call for the vote, and if the majority say yes, then she's in, and if not, or there's
Correct. I'm going to call for another name.
Okay, and we're going to do this verbally.
That's correct.
Okay.
Mayor Marshall?
Yes?
Mayor Pro Tem Cassidy?
Yes, please.
Councilmember Lavelle?
Yes.
Councilmember De La Rosa?
Yes.
Councilmember Ponce?
Yes.
Thank you.
You're welcome.
Thank you.
Number 9 is the Audit Committee. There are 2 members of the City Council that sit on the Audit Committee. Their job is to review all warrants that go before the City Council for approval. And just to clarify, I know I spoke to one of the new members coming in. These warrants are warrants that have already gone out, but your job is to review them and to ask questions.
So perhaps before nominations, let's just ask if there's anybody that's really kind of interested in that.
I am.
Okay.
Yeah.
Lisa, one?
I am.
Okay, great. Okay, so let's...
I can make the motion to nominate Councilmember Lavelle and Councilmember De La Rosa to the Audit Committee.
I'll second.
Okay, call for the vote.
Mayor Marshall?
Yes.
Mayor Pro Tem Cassidy?
Yes.
Councilmember Lavelle?
Yes.
Councilmember De La Rosa?
Yes.
Councilmember Ponce?
Yes.
And I have a question for further reference. What do you prefer we call your first name that we call you here?
You know, it's just easiest, Sarah. Let's go with Sarah.
Are you comfortable with that? Okay.
Yeah, but honestly, anything works.
I know, but
It's fine.
Yesenia is a beautiful name, but okay, just want to make sure going forward. Okay?
Item 10 is the Avalon Municipal Hospital Board of Trustees. At this time, the city council needs to appoint itself as to sit on that board and to appoint a chairman.
Can I make a request?
Yes.
I just stepped down from the hospital board. I resigned from the board yesterday, and I would like to, if I could, be the chair of the hospital board of trustees once again.
I'll make that nomination.
I'll second.
Okay, let's call for the vote. Thank you,
But
Michael.
shouldn't we make the motion to appoint ourselves first, and then we need to do that one first?
I'll make a motion to appoint the city council as the hospital board of trustees board.
Mm-hmm.
I'll second that.
Okay, so that's been moved and seconded, okay?
Mayor Marshall?
Yes.
Mayor Pro Tem Cassidy?
Yes.
Councilmember Lavelle?
Yes.
Councilmember De La Rosa?
Yes.
Councilmember Ponce?
Yes.
Then I will now make the motion to appoint Councilmember Ponce as the chair of the hospital board of trustees.
And I will second.
Okay. Call for the vote.
Mayor Marshall?
Yes.
Mayor Pro Tem Cassidy?
Yes.
Councilmember Lavelle?
Yes.
Councilmember De La Rosa?
Yes.
Councilmember Ponce?
Oh, what the heck, yes.
Okay, now for real serious business.
Yeah, exactly.
We have Matt Baker, our finance director, and he will be giving a financial update number 2.
All right. Good evening and welcome, new council. So just to provide a quick update of why we're having this presentation, the goal is to provide an update as the city's current fund status, as well as to forecast our anticipated revenues over the next 3 months. I will also be summarizing the steps the city has already taken to reduce our expenditures through this pandemic, as well as outline our plan to identify new revenues and new funding sources. So here is a slide similar to one that I had in our last update presentation. What it shows is a breakdown of cash balances by fund. As you can see, the chart to the furthest left is the fund balance as of February 29th, and the chart to the right is the fund balance a month later. As you can see in the general fund and the harbor fund, there was draws on the cash balance. Some of that was to be expected. February tends to be the slowest month for visitors, which means March tends to be one of the slowest months for city revenues. And for the most part, that's really what you're seeing there. A lot of the activities and steps the city has taken as far as expenditures really won't be appreciated until the coming months, just due to the timing of how those expenditures get processed. And there was some lost revenue due to delinquent taxes, but as I said earlier, the vast majority of our business community did pay last month. So I thought I'd also take this opportunity just to give a quick overview of municipal accounting. So it's slightly different from your traditional business accounting in that the focus is really on accountability rather than profitability. And so a good way to think of that as an example is gas tax. So when you pay at the pump, a portion of that is a gas tax which has to be spent on streets and roads. And so how we're able to demonstrate to the state and to the public that we are spending those monies on street repairs and street maintenance is by separating those activities in their own separate accounts or their own separate fund. And that way we're able to demonstrate when there's specific uses for monies how we are actually managing to make sure we're spending the monies as appropriate. The general fund is the main operating fund of the city, and it's unique in that it is unrestricted in how those monies are spent, provided that it's for the public good or there's a public purpose behind it. Some of the major expenditures we would see in those accounts from our cities would be public safety, so police and fire, as well as anything in planning or recreation, and a portion of our public works comes from the general fund. The general fund, like I mentioned, is the largest fund, and it is also the most reliant on visitor revenues to fund operations, and I'll go into that in a little more detail. The harbor fund is what we call an enterprise fund. What an enterprise fund is it's similar to a business, but the idea is that the users of the services being provided are the ones that are paying for it. So any of the costs that go into operating the harbor should be paid for by the users of the harbor. And so how we recoup those harbor costs is through the wharfage fees, the cruise ship fees, the nightly mooring fees, and the like. And so the reason I'm calling out the general fund and the harbor fund is those are our two largest funds, and they are also our two funds most dependent on visitors. And so those are funds that are going to be the most impacted in the short term by the stay-at-home measures and the other steps we've taken to limit the spread of COVID-19. So this is a chart that I used in the last presentation. Again, the pie chart on the left is a breakdown by revenue type. The chart on the right is a grouping that I have, and it's really just to highlight that our general fund is very reliant on visitor-driven tax revenue, so hotel tax, TOT, admissions tax, and even things like sales tax are, while residents do pay sales tax, the majority of our sales tax revenues do come from our visitors to the island. We're a bit unique as far as how dependent we are on visitors. Property tax in most cities is the primary revenue in the general fund, but we actually have the second smallest assessed valuation in LA County, believe it or not. And we actually had the slowest growth rate in property tax appreciation in the last year. And a lot of that has to do with the low turnover in property on the island relative to over town. So since we don't have property tax as a reliable source, and there's only 4,000 or so year-round residents on the island, we are therefore reliant on visitors, and without visitors, realistically, we wouldn't have a city. We wouldn't be incorporated. We'd be an unincorporated part of county. So this slide's just really a breakdown of some of my assumptions when coming up with our projections as far as where we're going to stand in the next 3 months. I'm working under the assumption right now that we will be in a stay-at-home measures through the months of April and May. Again, last time when I gave this presentation, I believe I had some activity resuming in May. Based on the information that I've looked at, I don't think that's reasonable anymore to expect, and so now I'm projecting that activity won't resume until sometime in June. I know Governor Newsom came out earlier this week, and he mentioned that he didn't think the peak in California would be until sometime in May, so I think it's likely that it won't be until sometime in June we'll start to see those measures lifted. And again, this is unprecedented times, so it's my anticipation that those measures will be lifted, not all at once, but in a phased approach. Another thing to consider is that Governor Newsom last week announced a deferment of sales tax owed for certain businesses. And while that's great news for a lot of businesses that might be running into cash flow issues, unfortunately, in the next couple of months, that may impact our cash flows, as depending on how many businesses take advantage of that, may impact the amount of sales tax we receive. So I did factor that in since the last update that we had. And then lastly, and the only reason I highlight it, is we actually have, and we get it twice a year, a large property tax payment. We got the estimate last week, and so I'm fairly confident in the property tax numbers, and since that's the only money that I can really say with some confidence that we're going to be receiving in the quarter, I just wanted to highlight it there. So again, just a quick overview of some of the steps we've taken as a city. We have implemented furloughs across citywide, and that's resulted in a general fund labor savings of about 12%, and an internal service savings of 24%. And so what internal service funds are, it's how we charge for the time for activities that benefit multiple funds across the city. So when I do finance, I'm not just doing the general funds finance, I'm doing the harbor funds finance, I'm doing the sewers funds finance. And so my time is charged appropriately across all these funds through the internal service fund. So as you can see, there's considerable labor savings that have already been implemented. Some of the challenges is that we have furloughed our employees still are receiving their medical benefits. But that also means there are some costs that aren't being impacted by those furloughs. This also assumes some reduction in our operating expenditures. Again, some of our expenditures, we really don't have much room to cut. So for example, some utilities for streetlights and the nature come out of our general fund. And so we don't really anticipate any ability to see cost savings there. And we have seen some increased expenditures, albeit not too much, but some just in responding to the COVID situation. Lastly, the two major contracts out of the general fund are the sheriff's contract and the hospital sales tax pass-through. So again, 0.5% of the 10% sales tax in town goes to the hospital, but it comes first through the city, and then the city cuts a check to the hospital. And so that and the sheriff's contract really aren't going to be impacted by any of the reductions we're talking about. So again, that limits our ability to lower our expenditures. So taking those revenue projections and those cuts that we've already made, what you see is that by the end of June, we're looking at a fund balance in the general fund of approximately $2.7 million. While that may seem like a lot of money, in the next slide I'll kind of go into detail why that isn't the case. As you can see, there are some monthly fluctuations, but in general there's a draw just on general fund operations of about $400,000 per month. So again, from lost tax revenue over the next 3 months, I'm estimating about $1.3 million lost in general fund revenues through June 30th. That remaining $2.7 million is really needed because the general fund kind of serves as the backstop for all other funds. As you may be aware, our sewer fund and saltwater fund don't really have a significant reserve. And so the timing of when we get our direct assessments for the sewer fund and saltwater fund means that sometimes they're operating in a negative balance, in which case the general fund temporarily loans money until those direct assessment payments come in. So even though there's money in the general fund, it may be needed to cover temporary shortfalls in other funds. And we'll go into it in more detail, but projecting out the harbor likely will be operating with a negative fund balance or no cash balance beginning this summer in July. And so again, the general fund would be needed to cover those shortages in those funds, or in that fund as well. The challenges is in the summer is when we have a lot of significant one-time expenditures. So that's when our workers' comp, that's when our general liability insurance comes due, and the general fund pays a significant chunk of those expenditures. We also have our Joe Machado loan payments comes during this next 3-month window over the summer, as well as certain other significant annual expenditures.
I'm sorry to interrupt, but is there any way, just like renters can spread things out, is there any way we can ask that the general liability insurance and workers' comp be spread out on?
We definitely will be reaching out to Parsac, who is our insurance provider, to see what options are out there. That's definitely something we've had discussions about internally with city staff, and to the extent those types of options are available, we will be looking to take advantage of them.
And can those numbers be reduced since we've furloughed so much of the staff? That why would we pay the big amount when we have less people working? Could that be?
Questions will ask Parsac.
Okay.
Again, the real challenge is, from a projection standpoint, is it's hard to really know what the summer is going to look like from a visitor level, which then translates to a tax revenue level for the city. The sooner we get visitors to the island generating tax revenue, the longer we can make these cash reserves last. The challenge is, at this time, we don't necessarily know what those revenue numbers are going to look like. And I'm going to go into a slide later on in the presentation that goes into a little more detail. But if we weren't to have visitor levels starting, or if we weren't to receive some type of federal assistance, likely sometime in August, we would start to be experiencing cash flow issues to the point where it would affect our ability to operate. So, we need cash just as much as any other business to operate, and it's something that we have to be considering when we're making decisions at the city, and that's led us to some of the decisions we've already made and some that we'll talk about later. So again, this is the Harbor Fund. Not to spend too much time on it, just to highlight again, similar to the general fund, it is also very reliant on our visitor-driven revenues to fund operations. Again, I'm working under the assumption that for the months of April and May, we will be in the stay-at-home, which means there will be very minimal wharfage payments for May and June to come in. I'm also working under the assumption that we will not have any cruise ship wharfages for the months of April, May, and June. And we'll also have very minimal mooring revenues for nightly moorings, as well as fuel revenues, given the restricted hours and the measures in place to reduce travel. So for there, what I did is I looked at the activity levels of the last week and kind of took those as the baseline. Again, it's not a significant revenue source, even if that were to be less. In the next chart, you're going to see the most revenue is actually coming from our MOLE grant, but that is a reimbursement, so that means we had already spent the money and we get 80% back. And at a certain point, we will actually have used up the entire grant amount, in which case 100% will be paid for from city funds. So again, we've taken similar measures in the harbor to furlough staff, reducing our expenditures by 20% and 24% respectively. We've also looked at maintenance and operating costs. Part of the reason we're able to lower the estimate so much in the harbor is looking at the fuel spend, which is a considerable chunk. We're estimating considerable, I wouldn't say savings there, but less spend, if you will. Again, one of the challenges with the harbor is that even though we've already taken steps to greatly reduce the contract services we have out there, the biggest contract we have in the harbor is for lifeguard and paramedic services, which we are still continuing to pay those for those essential services. And then this cash flow assumes the completion of MOLE Phase 1 in the next quarter. So again,
Matt, I'm sorry to interrupt you, but just back on paramedic and lifeguard, have we been able to reduce the fees associated with a lifeguard during these couple months that we won't have our beaches open?
that is something we are planning on reaching out to the county to see what options are out there. But right now, with these projections, I've kind of used what have been known. So that is something we have talked about, and we will be reaching out. So again, working under these assumptions, the Harbor Fund ends June with a fund balance of less than $250,000. And over the next 30 months, we estimate about $1.8 million in lost harbor revenues for April through June. Again, the harbor has significant operating expenditures that will be coming due over the summer months, including general liability insurance, workers' comp. The sewer also does pay, the harbor does pay charges to the sewer and solid waste funds. While that's a cashless transaction in that they're all city funds, it is money that is coming out of the harbor funds that the sewer and solid waste funds rely on as part of their operating budgets. Again, COVID-19 is likely to impact our summer revenues. The extent really is not known at this time. And the other challenge we're facing, even when we're talking about these cash flows and projecting out, is the city also does rely on tax revenues generated from the summer months to fund operations into the winter and spring. And so while a summer, even with reduced revenues, might provide cash flows in the short term, it wouldn't necessarily provide the level of funding we would need without significant cuts in order to offset those lost revenues. So again, this is an updated slide from the last presentation. Believe it or not, it does look slightly better than the version I showed you before, but it still shows the same general downward projection. And so really what I'm trying to emphasize here is, the city is looking at every possible avenue of places where we can lower our expenditures. But the challenge is without visitors, we aren't able really to operate as a city. And so what our strategy has to be is to do everything we can to make what money we do have last as long as we can make it last. And that way, either it provides us time for when we can have a new normal level of visitorship that we can operate within our means from, or it provides us time to advocate for Phase 4 funding through the CARES Act for additional revenues to make up for these lost revenues. The biggest challenge in projecting what the summer looks like is it's a very dynamic situation, and I want to preface this slide with that I am not an economist. I've done my best to try to see what people can expect, but it's a very dynamic situation. The chart on the right really is just showing how unprecedented this challenge is that we're facing. So it's and I apologize, it's small. It's showing unemployment claims by the week, comparing the Great Recession to COVID-19, and you can see that the scale of the crisis, at least from an economic standpoint, is really unprecedented. Part of the challenge is from a recovery standpoint, everything I've read points to that the sooner the economy can get back in the running, the higher the likelihood of what they describe as a V, or a quick return to normalcy. But the challenge is all the steps we're taking, and rightly so, to save lives also extends the duration of these stay-at-home measures, which likely will have the opposite effect economically, in that it will extend the amount of time it will take for spending and activity to go back to normal. There was a lot of measures in the Phase 3 of the stimulus package designed for small businesses. From a city standpoint, most of those are really focused on reimbursement. Unfortunately, we haven't had to expend too much as far as city funds to respond to the pandemic, but that unfortunately means there's not that much funds available, at least in the Phase 3 funding, for us to be reimbursed for. So we're really focusing on advocating for Phase 4 bill, focusing on cities. We aren't going to be the only city in this situation. Unfortunately, though, our reliance on visitor revenues does make us, I would say, a prime target, if you will. And then the other challenge we have is going forward, this will have an impact on visitorship. To what level, we don't know. But typically after a recession, savings go up, or at least what's called precautionary savings, so people's kind of rainy day fund, if you will, which directly cuts into the discretionary spending someone might have to, say, come to an island. The other thing that's really unknown is the impact of the cruise ship industry. Unfortunately, the COVID-19 created some issues for the cruise ship industry, which will have a ripple effect on the city. In this year's budget, we're estimating cruise ship revenues of $800,000. So if we were to lose that, that would be $800,000 in the harbor fund that we'd have to make up. And just to kind of put this really into perspective, is even if July 1, 100% of our normal visitors came, but we had to discount hotel rooms, say, by 20% to make that happen, that would be $1 million in lost general fund revenue. That's more than most departments at the city. So even in the most rosy best case outcome, we're going to be looking at systematic changes to the level of service at the city for likely several years. And that's just the reality of the situation. So what are the next steps? The city's already made additional furloughs today before the meeting. We've also are looking at further reductions to non-essential maintenance and operation expenditures. We will be reaching out to Parsac, and we'll also be reaching out to the county as discussed. We are also looking at additional revenue sources. Business and tax interruption insurance coverage, I'm not holding my breath, but we do have claims pending. There are some money in restricted funds that might be potentially available as a interfund loan or some other financing mechanism, but that is unknown at this time. And then lastly is any state or federal assistance, which is what we're really going to be counting on if we want to be operating at a level of service comparable to what we were at pre-COVID. And with that, unless there are any questions, it's my plan to give another update, not at the next council meeting, but at the first one in May. But I'm always available to answer any questions.
Could I just get a clarification? Our staff that have been furloughed, are we still maintaining their medical benefits for them?
Yes, we are.
Okay, thank you.
Just a question that was posed to me was that since there's both furloughed staff in the city and the mention of taking potential pay cuts, if we as a council should also be doing the same to lead the way with that. So
No, that's not gonna say anything.
I don't know if we need to bring that back to the next meeting to discuss, or if we can make a decision tonight on that, but
Are you suggesting that the little stipend you receive
Yeah.
not be?
I know it's not a big amount, but at least it covers some hours until something. It may cover the cost of something over a span of months that may help.
That was a Scott question, because we'd asked about that once before, whether we could.
What I would suggest that that many cities have done is they have just had the council donate that back to the city. If you wanted to have a formal action, we could bring that back at the next meeting for formal action. But many council across the state have just donated their money back to the city and not taken a tax deduction.
We want to start on a voluntary basis first and then go from there? Okay. Okay.
Any other questions for Matt?
Thanks, Matt.
Isn't this fun, Yesenia?
Oh, no.
Now I'm going to call you Yesenia. So you said, Matt, but you made the comment about the state and federal assistance to get us back to the level that we were. Even with state and federal assistance, we don't need to get back to the level that we were because we don't have visitors for a while, right?
Well, the challenge is if we don't have visitors, we don't have visitor revenue.
Right.
So if we did receive some any funding would obviously help.
Okay.
And if it's a reduced amount, we could just decide that if just say going forward the monies would be enough to cover the loss in the year, maybe we could make adjustments less drastic. But it really just depends on one, how soon visitors start coming back, and then two, what, if any, assistance becomes available. And that's what makes it hard right now to come up with a long-term staffing level or a long-term plan for the city, because right now it's really unknown what the true impact COVID-19 will have on consumer spending.
Yeah.
Right now I'm here and I'm maybe not sounding the most optimistic, but the situation is dynamic, and as it goes on, the more information we have, the better understanding we'll have of what the likelihood of that aid would be, and two, how much it could potentially be, and then also what the consumer impacts of the virus are. So, yeah, I might not sound that optimistic today, but there's hope that if there's aid out there and we're able to get there, maybe I'll sound more cheery in a month.
Matt, have we looked at how this is compared to 2008?
From just an unemployment standpoint, it's almost not comparable. It's astronomically higher. The real difference from like a city revenue standpoint in 2008 versus now is you didn't see such an immediate drop off in revenues. It was a much more gradual decline, and what that really buys not only our city but any city is time. So if our tax revenues went down, say 30%, the city would have to make very significant changes to the way it operates. But if it went down 30% each month, we would have time to make those adjustments, and they wouldn't necessarily need to be made as soon as they do now. So in the 2008 recession, the city did look at its staffing levels, and it made adjustments to the way it spent and the services it did. But the big difference is they were still getting, say, 60% or 70% of the normal revenues that they were used to operating, and that bought them more time to make the necessary adjustments. The challenge is now is we're going to be having to make those adjustments when we really don't know the true impact. And it's possible that when the restrictions are lifted, if people have stimulus monies available and they're sick of being in their houses, they want to come out, and we might be the perfect destination for that. And so there is hope that this would be a quick economic recovery. Personally, I think the longer, though, the stay-at-home measures are in place, the less optimistic I am for a quick economic recovery. But again, I'm not an economist. I'm just trying to read how I see it. But
No. Yeah, those aren't rose-colored glasses that you're wearing today.
no,
But he says it with a smile. I know.
not much else you can do.
When he shows up with that Grim Reaper costume, I'm really going to be bummed.
Well, I would be worried if you were like,
Oh, yeah.
that would make me nervous, but
Yes.
I appreciate that.
And I mean, the only thing I can say is we'll know more in a month than we know now. And even if that's bad news, in some ways it's good because we'll be in a better position to make the right decisions we need from there. I think the biggest challenge right now is there's so much uncertainty as to what the true impacts of this will be. So,
In the way that a lot of private businesses are offering future spends with discounts or add-ons, because the harbor seems to be the most immediate guest-facing source that we control in terms of the funds that we have. Does it make sense to look at utilizing the harbor to say, if you book and pay for now your 2021 summer experience, use half the harbor to be able to generate part of that revenue now and at least have money to fill that stopgap until, if you could make payments now for summer of next year, where hopefully, fingers crossed, we're able to operate and we don't get a second or third wave of this, that may be something to look at, generating revenue now and have it run for a short period of time to actually draw funds in before we hit the end of August or September and run into fund issues. I don't know if it makes sense to try to look at ideas like that to try to start generating revenue where there may not be some right now, but maybe for the future.
I mean,
voters tend to have at least some money to be able to spend usually.
I'm open to any and all suggestions, and that might be a possibility. My only concern would be is if that just delays cash flow issues into the
Right.
next summer.
Right.
So we'd have to make sure that it did pencil out. But again, right now, kind of our immediate concern is cash flow.
Sure.
But again, I also want to make sure that we can operate, indefinitely. And so that might be a possibility we can look into.
Okay. Any questions or other? Okay. Thank you very much, Matt. Thank you. Okay.
Okay, the last item on our agenda this evening is a second urgency ordinance. And just as a reminder, we adopted an urgency ordinance at our special meeting on March 25th, and that urgency ordinance had a couple components to it. The first one of it was a moratorium on evictions due to non-payment of rent. And that was for residential and commercial properties. And then the second part was the prohibition of certain transient occupancies, the CUPs in town. And then there was a third part, but it's only going to be enacted once it's deemed necessary by the sheriffs, and that was as enacting a curfew and a loitering restriction. So this ordinance tonight enacts a temporary moratorium on rent increases, and it is only on residential properties. The city attorney advises that we could not do that on commercial properties. And it's limiting hotel occupancies to those engaged only in essential services. This moratorium would only go for 67 days through May 31st. That's the same time period that was in our first urgency ordinance that we adopted. And I just want to point out one section, it's on the bottom of page 2, that the ordinance creates a mechanism for a landlord to seek an exception to the rule from the City Council to ensure a just and reasonable return on their investment, which is a standard practice allowed by any rent control measures. The proposed ordinance also does not apply if the unit or property is exempt from rent control under Costa-Hawkins, which is California Civil Code Chapter 2.7, or if the unit or property is otherwise exempt from local rent control under state law. The Costa-Hawkins generally does not allow any local rent controls on buildings built after 1995 and is subject to other exemptions. It is recommended that the City Council consider this proposed measure for a limited period of the 67 days, as I stated before, and that is strictly for the rent control. The second part of this is a limitation of hotel occupancies to persons engaged in essential activities, and I do want to read the 4 things in here that are part of that. This limits hotels to serve as a short-term lodging facility that are used for the following COVID-19 mitigation and containment measures and essential activities only. The first one, lodging to protect the homeless population. 2, lodging for persons who have been displaced and cannot return to their residence because there is a person residing at the residence that must isolate or quarantine or is at a higher risk of severe illness. 3, lodging for persons who need to isolate or quarantine. And 4, to house essential workers performing functions that are essential to maintain the continuity of operations for critical infrastructure as those terms are defined in the Governor's Order N3320, and to house workers for essential businesses, essential infrastructure, and healthcare operations as those terms are defined in the Los Angeles County Safer at Home Order. If approved, just to state again, the ordinance will go into effect immediately upon adoption and will remain in effect until May 31st, 2020. In order to prevent inconsistencies in the law, the city manager may also suspend the ordinance if it is similar to federal or state law that's adopted.
Okay, I have
Do you
a
have any questions?
I have a question, and tell me again what the answer is. Why doesn't it list residences, VRBOs and Airbnbs and other houses? Why is it just hotels?
Because at our last urgency ordinance, we stopped the vacant. We already stopped that.
We did that last time, but we didn't include the hotels in it.
Okay, good.
Yeah, so now we've just...
And if I could just, these 4 categories for hotels, what that means is if a hotel wants to do it, it can.
Right.
It's not saying that hotels have to house these people. What we're saying is hotels for visitors coming over for vacation, who are coming over from over town, they're not allowed. People, though, that are necessary to do critical infrastructures matters, like if there's a problem with the Edison plant and someone needs to come over to fix it, if someone needs to be move out of their home because it's quarantined, a hotel can open its door to these people. Doesn't require them to do it. It's up to the individual hotel in each and every instance. The purpose of this is to make certain that the stay-at-home order, which bars people from leaving home for other than essential purposes, this gives us another weapon or a tool to use for the city to enforce the statewide and county stay-at-home ordinance. We did look at this also to see if there's a way on the commercial rent, if we could do a ban on commercial rent increases, and the state law is quite clear. The governor and the state legislature have done what's called occupied that area. In other words, they have said that no city can make any regulation whatsoever with respect to commercial rent. And so the city cannot do that, but you can for residential rent increases. I will tell you that this moratorium and the previous urgency ordinances that you have adopted put you probably in the top 1% of cities in the state of California in taking proactive measures to protect your citizens and residents from COVID-19 as well as the economic fallout from COVID-19. And this needs a 4/5 vote to pass because it's an urgency ordinance, which means it would go into effect the moment you pass it.
Scott, I have a question for you. This just is really for one more month. Is there any way that we can extend this through till the end of the year?
Well, this is for when you declared an emergency. When Avalon declared this emergency, it declared it through the end of May. And so this ordinance matches that period of time that you have declared an emergency. What we anticipate is that in May, either at the first meeting or second meeting, we'll bring back another measure if depending on the situation, to extend the length of that emergency, and then the council would be given the decision whether you want to extend any of these urgency matters beyond May 31st.
Scott, I do not like to disagree with you, but I am going to disagree with you. Our emergency measure that we took to declare an emergency, there was no timeline on it. Our first urgency ordinance, however, had the May 31st deadline, as well as this one. Michael and I were just looking at that today, and because our hope is to keep recouping any kind of reimbursement, so we know that even once the COVID-19 emergency is over, the crisis is over, we will still be seeing the results of this, December, January, whatever.
Yes, I'm sorry, I misspoke there. The emergency goes until the council declares it's over, and the reason for that is under the FEMA laws, if you are financially impacted for a period longer than you have these urgency measures in, we want to keep the emergency extended as long as there's an economic impact to the city, so that we can ask FEMA to reimburse you for all the economic impacts. But you will be given the opportunity in May to consider extending all the measures in the urgency ordinances further.
Yes.
Does that answer your question? Okay.
Yeah.
So it can be extended.
Okay. So I would make a motion to adopt an urgency ordinance of the City of Avalon.
I'm sorry, I do have a I have a comment.
I was going to say we need to.
Do you want me to read that in first?
Yeah.
Sorry about that.
That's fine.
So I did receive one comment. This is from Mary Schickling, and she indicated that she was in support of it, but she asked, is it possible to extend the moratorium on rent increases? So many people in Avalon work in the service industry, and I think it might take them a while to rebound from sudden unemployment and almost total lack of income, assuming they can get a pittance from EDD. Can we extend the moratorium to 6 months or even 12 months after the stay-at-home order is lifted? I don't think this virus is going to be gone and businesses reopen on May 31st. With this, rents could be raised June 1st.
Do we just keep extending every month, right?
No, we extend it, well, like this
I
one is.
think what the option would be when we come back in May, we'll know better situation as to how things are, and at that time the council has the power to extend it 1 month, 2 months, 3 months, or to the end of the year. It is up to you to make that decision.
Well, and then I have a question. So they increased my rent and we put this in. What does the tenant do, or who makes the move to rescind that rent increase? Does Mary Schickling write a letter to the landlord and say this is the new ordinance, or how do we do that?
The tenant who is impacted by a rent increase would inform the landlord that rent increase is improper under the urgency ordinance. And if that landlord refused, then the tenant could come to the city and we could take action to enforce the ordinance by sending a cease and desist letter to the landlord indicating that you cannot raise rent, and it is invalid.
And we went retro to March, right?
Yes, we did. We went retro to when you declared your emergency.
Okay, thank you.
I just think it's unconscionable that somebody would do that right now. He did, and it's unconscionable.
Ours mentioned it as well.
What's that?
Wanting to raise the rent.
Wow. I just cannot even fathom that. Anyway,
I did receive one more comment.
we did answer Mary's comment already. I just want to put that on the record.
Yeah, thank you.
Okay.
This one comes from Jim Lutyahan. He says, assuming it is adopted tonight, how will hoteliers be notified?
The city will contact them, and Jim will have Jim put something out over the chamber's communication.
And that's all the comments I have.
Okay, Cindy, ready now?
I will make a motion to adopt an urgency ordinance of the City of Avalon enacting a temporary moratorium on rent increases, limiting hotel occupancies to those engaged in essential services and activities, and setting forth the facts constituting such urgency.
And you would also waive further reading of the ordinance so I don't have to read the 10 pages of it.
And waive further readings of the ordinance.
I second.
Okay. Moved and seconded. Any discussion? Call for the vote.
Mayor Marshall?
Yes.
Mayor Pro Tem Cassidy?
Yes.
Councilmember Lavelle?
Yes.
Councilmember De La Rosa?
Yes.
Councilmember Ponce?
Yes.
Well, I think that's it. I would like, on behalf of the City Council, I would like to wish everybody a very happy Easter. And if I would like to see if you're hiding the hard-boiled eggs at home in your home, make sure you have a map of where you place them, because you don't want them reeking in your house 6-8 months later because you forgot where you put them. Everybody, happy Easter.
Easter.